Good afternoon, everyone, and welcome back to our first day's post-lunch session. And this session is focused on the theme of challenges or barriers in implementation of school mental health and well-being in the schools. And to take forward this session, it is my pleasure to welcome two esteemed chairs for this session. I welcome Professor Nilima Bhagwati, who is a retired Professor Emeritus from Guwahati University and a stalwart figure in the field of teacher education. Ma'am has very many years of experience, not only as a faculty of teacher education, but also at ground level working with students and their mental health issues and the stakeholders who play a critical role in contributing to mental health and well-being of school-going students. Madam is also the chairperson of the focus group, national focus group, which focused on developing a position paper on mental health and well-being, taking forward mental health and well-being and guidance and counseling towards integrating it in the new national curriculum framework. So welcome Nilima ma'am to the conference and to this session. Along with Professor Nilima Bhagwati, we have Professor Prabhat Kumar Mishra, Head of the Department of Educational Psychology and Foundations of Education in CERT. Sir has also been involved with guidance and counseling and is an expert on stress, particularly of stress of students. So welcome to you also, Professor Mishra. He is here with me in NI conference room. And I request now both the chairs to please come and begin the session for today's first afternoon session. Welcome. Professor Nilima. Professor Nilima Bhagwati, over to you, ma'am.
Yeah, I got it now. Start my video, just a minute.
Namaskar, Sushmita ma'am.
Hey, namaskar, Dr. Nagpal. Namaskar, welcome.
Okay, namaskar and warm greetings to all of you. It is really a pleasure to be here in front of the August gathering. I'm sitting here in Guwahati, and the pertinent issue which is going to be discussed today, everybody knows about it, that it is the hot topic, I should say, the most sensitive topic. And our objective through the discussions is to bring a massive awareness on mental health. So I welcome the participants to this need-based session, which is on implementation of mental health and well-being in schools. I'm confident that this session will be highly impactful and informative to draw a roadmap, so as to say, to draw a roadmap for removing the barriers and the challenges which are existing in implementing mental health and well-being of our children, students in our schools. Friends, when we speak of good mental health, or rather healthy mental health, we all know what it implies, okay? It's a balanced state of mind. We just say that casually, balanced state of mind for successful performance of any kind of activity, like positive or constructive behavior. It can be positive verbal expressions, the interpersonal relationships. It can be the ability to adapt in different situations or the surrounding situations, as we say, and in, like the adversity or coping with adversity, which is very important, and many more. So therefore, person with uninterrupted mental health realizes his or her ability and have no problem in coping. Indeed, they have no problem in coping with stress of life or anxiety or any other sort of, like sick mental health They don't find any problem. On the other hand, the negative for poor mental health, it just implies the reverse. Therefore, we know that if when we talk about the unhealthy mental life, that means it affects our day-to-day life. It affects our day-to-day life. It affects the day-to-day life of our children and developing particularly emotional and psychological turbulences which crops up, creating interruptions in the holistic development of our children, students. And you all know that both physical and mental health, they're interrelated. We usually find from our own example sometimes when we're not well, we are mentally down, or when we are mentally sick, we just show lots of excuses. So also with others, lots of excuses. That is, what is the interrelation between these two? Now, friends, just as a person, when he is sick physically, right? Or when we say a person has health measure concern, so is also the mental health. Now, right now, we are witnessing major global mental health. When I go through certain journal or go through the reports in the net, read out, that it is not restricted only to one corner of the country or one part of the country. It is a global crisis among students. It is among adults and elderly people, or say it is existing in the cross-sectional society. And this is one of the major challenge we have in front of us. I went through some data last evening, and I have found that the data reflects that in 2019, 970, it's a big figure, 970 million people globally lived with poor mental health disorder and anxiety, right? And depressive disorder being the most common. Now in 2020, we find that mental disorder rose significantly because of COVID-19. We all know about it very well. And the data reflects that 150 million Indians had mental health breakdown and were in need of mental health service. Therefore, the root findings, if we go through, I will not elaborate in details, that there are lots of root causes are there. It may be the stress, the anxiety, the stressful relation, it may be loneliness, domestic violence, it can be, the closure of the school during pandemic, the backlog in studies, the uncertainty of the future, and also the lack of supportive system, which is very important, lack of supportive system, as well as economic hardship, or we call it economic suppression. So these were some of the, causes which led to the mental health problem, which we found particularly in the pandemic. And what I have just mentioned to you right now, these were some of a little sort of survey I did during the pandemic in a nearby place. The students are from the government schools, and most of the causes which I have mentioned to you were the findings of my study. Anyway, the mental health is witnessed largely, and now if we say that it is not the end, it is still going on in the society. It is still going on in the society. We are unaware of it. To some extent, we are also neglecting it, ignoring it, because most of the people in the society, they shy away, they keep away from certain questions. When somebody is in depression or somebody is in isolation, do not like to meet people, or has social problem, they just keep it shut. They don't want to put it in front or go to the psychiatrist or go to the counselor. So these things are still going on in our society, friends, and this is one of the major challenge before us. Therefore, it is pertinent, it's extremely pertinent to assist our students, to assist our children, the community, to be aware of sound mental health, which is very, the need, I should say, the need of all of us, including the children and the students, from the foundation stage of education. When a child comes to school, when the child goes to school, from that very day, he faces lots of problems or may come across certain problems. And the teachers, the parents, the school, the administrator, everything should be aware from the right point and take him ahead so that he can develop very sound, very healthy mental health and accordingly go on. So what we say right now, we are very much talking about our younger generation. And of course, they are the leaders of tomorrow. They are the driving the driving force. The right word would be force. They're the driving force of the nation's development. Okay. Therefore, it is very important for the teachers, the parents, the principals, the administrators, the stakeholders, and everyone around, to be aware of what is mental health. Mental health can be preserved, and sustainability is the question how it can sustain. It is not that somebody is mental health, he has been detected or identified with a problem, and we just leave him over there, take him to the psychiatrist or take him to the counselor. No, we have to see that the sustain, he gets well, and it does not fall back into the unhealthy situation of the mind again. And just now, I'd just like to point out one important thing over here regarding the national education policy, the very historic national education policy. It focuses on holistic development. So how can we have holistic development of children if the mental health is sort of damaged? If the mental health is not itself healthy, it will not be possible for us to reach the target of holistic development. So this is one of the another very pertinent aspect which we have to keep it in mind, not only as parents, but as teachers, administrators, as stakeholders, and as societal members, to look into these issues very clearly. Therefore, to translate the holistic development into action, we have to be the frontline workers. We have to be the frontline workers and take these issues very sort of in a way that undesirable sources, undesirable factors, they do not bring barrier, they do not develop barrier or create challenges in the mental development of our students community or the children. Therefore, we should be aware of it. And I'm very happy that this particular national conference has been on mental health, and it has given, I went through the themes, all the themes are extremely important themes, and definitely for all the principals who are attending, for all the teachers who are attending, or all those who are associated in the field of education, it will be extremely important for you. And one thing, my friends, we should all remember that when we talk of children, that we find that during the developmental stage, particularly during the transition time, when they transit from one school to the other school, they are in need of mentors, they are in need of counselors. There's lots of problems crop up during that time. So we should be able and make ourselves prepared that every teacher should be the first level counselor. Everyone should be the first level counselor so that they can identify what problem is there. If the problem is serious, that is something different that will be sort of record. But the common problems or the other problems which you find in the classroom, which you find in the, the institution's ambience or environment, we have to train our teachers in such a way or administrators such a way that they can identify and take the needful help, give the needful help, or be the supporting system so that they do not fall back to the unhealthy state of mind again. I am happy that today we have three experts. They are all, from this field of mental health. We have with us Dr. Jitendra Nagpal. He's a senior psychiatrist and working group member, MANODARPAN NCRT. I welcome you from my end, sir. We have with us Dr. Saurav Kumar, Assistant Professor, Regional Institute of Education, Bhopal. I welcome you. Dr. Sushmita Chakrabarti, Assistant Professor, Department of Education, Psychology and Foundations of Education, NCRT. I also welcome you over here. We'll hear you, all of us will hear you, and I too hope we'll be able to draw a roadmap how to move the barriers, how to remove the challenges. The challenges are there, but we have to overcome the challenges. And this particular session will concentrate on it. I welcome all the speakers the experts who are here with us. And regarding the time, I think there will be 20 minutes to each of you so that there is some space left for question and answers. And to sum up, so I request Dr. Jitendra Nagpal, Senior Psychiatrist and Working Group Member, MANODARPAN NCRT, to begin from your end, please, sir.
Good afternoon and very much thank you, heartfelt thank you, Professor Nilma ma'am. It was indeed heartening to listen to you. I could not only recall, but I was nostalgic about how we have evolved as clinicians, as people in the medical science, as medical professionals, trying to create a difference in the early stages of such problems. But then the whole complex, very complicated approach to understand the early stage itself has been a big debate the world over. What is the early stage? What is the early intervention? What is the early identification? That word early has been a very complex and complicated matter as far as mental health and well-being are concerned. You have raised a very important question also, ma'am, indirectly, where are we able to even prepare children for tomorrow when it comes to mental health? The NEP for the first time, because it is NEP 2020, and when we reflect back to NEP 1986 and NCF 2005, the words of psychosocial well-being are not new. They were mentioned. Rather, when you historically mentioned about the role of how education actually embodies the complete, the macro system of the human thinking, emotion, and behavior. Now, that has always been part of the teacher training, more than medical science and doctors training. Because when you compare the two, I do feel the first myth, which is my core topic today, as Dr. Sushmita mentioned, though my passion involves in complete advocacy and awareness building about mind, mental health, and behavior. But since today we are talking specifically on certain areas, the biggest myth today is to even accept that mind is a component of good health. The fundamental myth, अगर हम स्वास्थ्य की बात करते हैं, तो क्या हमारी परिभाषा physical, mental, social, and now the fourth dimension, spiritual well-being, is the common parlance understood at a young level in the family or in the school? The answer still remains it is far-reaching. We have not yet scaled the journey to actually include and make mental health inclusive of the general health paradigm or the general health curriculum. It has come now. It has come now in the last about 2 decades. But because it has come as a dialogue and a debate, now we need to put it into action. I personally believe that, yes, that is the whole idea about why MANODARPAN is created, why interdisciplinary and intersectorial dialogue is so important. Now, coming to the second myth. The second myth is that mental health by itself is competitive to mental health, going by the current stigma what we are seeing, especially post-COVID. It is competitive to physical health. No, the truth is that mental health cannot be seen as competitive to physical health. It is complementary to physical health. The more and more we have segregated the idea about mind and mental health and mental illness from the bodily parameter of a young growing mind, especially the children, I think the stigma, the prejudice, and the judgments, and also the discrimination has been high. So the first two myths what I'm talking about, understanding mind as a component of good and well-being health, and looking at mental health as not being competitive to physical health. It is a complement. They integratedly go together. They cannot be seen in isolation. Therefore, today education does not talk about only literacy. Today education talks about the major goals. The major goals are focused on health, well-being, and the overall effective communication about it. How the child is involved as a learner, how the child has a right to be protected, to participate in his well-being, to also develop the overall personality. So from literacy to education, from education to overall human development, if that is the telescoping of Indian education, then I think it's high time that mind, mental health cannot be seen in isolation. It has to be part and parcel of everyday step a child takes, every day interaction a child does, and every day observation a teacher does or a parent does. So I think I'm quite clear in uh, appreciating the fact, which I've learned a lot from teachers also, not just in medical science, that we need to see school mental health as so much embodiment of the daily schooling process. कहने का मतलब ये है कि वो silently मानसिकता के बारे में हम रोज जी रहे हैं. We don't have to make special arrangements for mental health as such because it was neglected, because it was ignored, because it was condemned as craziness or being pagal or being iska hua. These are where all somewhere the prejudices which have been used for traditions long years back, from the First World War to the Second World War. Let me tell you, ma'am, the whole idea about moving away from mental illness to mental wellness actually came in after the Second World War, because that is the time when the world got shaken up into millions and millions of soldiers who were marooned and became victims of mental illnesses. The first comprehensive idea about integrating hospitals, integrating schools, integrating institutions of learning with mind and mental health as a curriculum came just about 50, 70 years back. So it is not that it is a very old ideology. Thinking about mind has been thousands of years ago, if you look back into traditions. So the automatically the myth which comes in is there hope for people who suffer? Is there hope for people who suffer? If I take that as a third myth, the fact is that there is much better hope, there is much better positivity than many of the physical ailments. Unfortunately, the application of black magic, voodooism, tantrism, भूत प्रेत की जो बातें होती थी और किस तरीके से मानसिक कंट्री में होते the faith healers involvement. So the involvement of occult measures in remedial approaches to mental illness actually became the reason for the stigma about the mind. If the mind has a stigma today, it is because largely about the way the mind as a component of good health was seen in terms of remedy. कोई अगर डिप्रेस्ड है या बिहेवियर उसका ऑफ द ट्रैक है या एबनॉर्मल माना जा रहा है, तो उसका इलाज भी ट्रेडिशनली कहीं ना कहीं एक ऐसे सामाजिक कलंक से होता था. फॉर एग्जांपल, आई कैन रिकॉल scores of patients recently of young people, I'm talking about 11-year-old, 14-year-old, 18-year-old, both girls and boys, who have been actually taken to tantrics, who have been taken to jhadu puka, and also in many parts of the country, in urban India also. There are only spiritual measures or maybe some very deterrent measures taken up by the family to somewhere close the whole idea about symptoms and bring the person very close to normalcy. But that is a myth. It has actually spoiled many of the young people, many of the majority of the teenagers. And let me tell you that largest majority of mental illness as a percentage, the mean age for starting is 14 years across the globe. The World Mental Health Report, which has just come about 3 months back, states that teenager, the 14-year young person as a citizen of the country, is the most important median age for onset of all mental disorders, because the vulnerability is high, the confusions are high, the bodily, the mind, and the social changes are maximum. So are we protecting them at that point? So since today morning and the conferences which are going to happen even tomorrow and day after, the focus is to actually understand children better, understand the teenager better from the mythical avenues that we have cluttered them. The fourth myth which I'm going to tell you is, it all depends upon how we are looking at mental illness as a isolation of human character. Most of the people we come across in severe cases, they are thought to be somewhere lost in their character. Now, what a condemnable stigma onto the child. Can you imagine? If a 11-year-old or a 14-year-old is bullied in the school because the child is mentally disturbed due to the family environment or due to the pressure of the rejection by the peer group, or somewhere the body image and the body shaming and all the new type of digital rejections that we come across in young people where validation is lacking. Emotional validation कितना जरूरी होता है हर बच्चे को. वो validation अगर दोस्तों से, माँ बाप से या टीचर से उनको नहीं मिलता है, एक affirmation नहीं मिलता है, the chances are that their biological function, their psychological function together deteriorate. Again, I'm repeating that it is a product of the interaction between a biological, psychological, and social factors of life. It is not just about mind and the mental health alone. Every growing organism will have changes in the bodily profile, will have changes in the chemical profile of the body with the symptoms of the mind. Now, this starts very early. We have seen very young children, as far as millions of them recorded in the literature and the books, where 4-year-old, 6-year-old who are having a very disturbed or dysfunctional family environment. I'm sure every teacher knows about it. Every counselor and every school doctor knows about it. But they're not identified. They're not identified early. That is why the reason today that our percentage of young people has crossed more than 15 to 20% of the population who are mentally disordered, because they are hardly or very occasionally found suffering at an early stage of their symptoms. So remember that mental illness is not at all somewhere to be labeled as a fault in the character of it or in the general behavior of a child. There are many factors which interplay. Another factor is that they are not treatable. They are not remediable. But fever, cough, malaria, pneumonia, COVID, if they are treatable, then depression is 100% treatable. Anxiety disorders are 100% treatable. The myth is that they are part of living with the child and they'll grow up to be adults who are somewhere not in their mental capacity to live life fruitfully, rewardingly, or to the best of their capacity. If today mental health is defined as a positive quality where you are living a rewarding life, a fulfilling life, where something like happiness is somewhere in the world around me and within me, if that is what the lessons in the school are, then I think the child has not to seek happiness. He doesn't have to chase happiness. It is all in the immediate surroundings. We need to appreciate that each other's emotion is respected, validated, as I said, and also appreciated. Because somewhere down the line, the sense of isolation is the spark of beginning of so many mental illnesses, a sense of isolation and a sense of rejection. Mental illness are somewhere affecting the entire family. We have come across in literature, even if you see the National Mental Health Surveys and the World Mental Health Status Report, each every family member, unlike in hypertension or diabetes or obesity, or maybe even say road traffic accidents or cancers, here each and every family member eventually gets affected by their way of living a fulfilling and a rewarding life. So the myth is that, okay, it is something that affects one person, and the reality is that it starts affecting the whole family. And within few days, we have seen families going through temperamental paradoxes, as we call them. These are temperamental acute stages in the siblings, in the parents, or reactions which are completely abhorrent. Haven't we heard of mass suicides? Haven't we heard of copycat suicides? Recently in Delhi, there are at least 3 to 4 families in the last 1 or 2 years where the entire family decided to give up life. And the suffering was maybe in the youngest child or the eldest child going to the school or the college. The helplessness, the hopelessness, and somewhere the hostility between each other. Now here is where school can help a lot. It will remain a myth unless we help each other or the neighborhood helps each other. So I'm sure there are so many discussions going to happen on this. Another important part is that it is a thing where they cannot live within the regular day-to-day societal movement. Let me tell you, unlike many other physical problems, now whether we have tuberculosis, whether we have cancers, where a lot of time sanatoriums are required, a lot of time rehabilitation centers are required. Each and every state in the country today is trying to close down mental hospitals. The focus is link mental health management to the general society intervention. Now, for example, the general hospitals, now they are being prompted, they are being pressurized to actually take mental health as departments, as advocacy integrated to other departments. जो mental asylum का concept था, we all know about that. You all have heard about uh, very big high-walled hospitals like the Ranchi Mental Hospital, the Agra. We have old hospitals in Bareilly. So many of these are still existing. When the purpose was not about mental illness, the purpose was somewhere revolting behavior or protesting behaviors. They were pushed over there during the pre-partition years. So today we find that we have to see it as a part of the classroom. We have to see it as part of the teacher training. We have to see it as a part of teacher as a best counselor, because he or she can identify those sparks which could be deviant, deficient, or delayed development. Remember the 3 Ds, which we have learned from all of you: the delayed development, the deficiencies, and also somewhere the deviant patterns of behavior. Why do you think the juvenile crime has gone up in our country? Have you ever thought? Today, the juvenile crime is 10 times higher than what it was just a few years back. Below 18 people, citizens of the country, coming under surveillance for behavior, for heinous crimes. The reason is not being able to contain themselves during the schooling years, not being able to relate with the family environment. So in the society, they automatically, unknowingly, unintentionally create the unrest. And these are urban Indian educated children. Many of them often go to jails also when they are grown up as adults. So remember that this can actually harm the entire family. It can harm the entire school system. If not, it is not about one having a physical ailment and you can go to a hospital and get treated. The disruption happens in the total environment. So the economical cost to the school, the economical cost, the social cost, the disability years which are gone by, one developing schizophrenia or bipolar disorders in young age. As I told you, the median age for onset of all mental disorders across the world is 14 years. So we cannot ignore understanding, awareness, and also celebrating what we are celebrating today. The idea about integrating mental health into each child's life as a part of their day-to-day living. Then only the family will understand, then only the grandparents will understand that it cannot be shrouded in mysteriousness. That's one of the biggest myths. कि इसका mysteriousness है, पहेली है, ये abnormality जो है ये कर्मों का फल है, ये abnormality जो बच्चों में है या घर के सदस्यों में है वो पिछले जन्मों का कर्म है. That is where mental illness has suffered stigma, prejudice, discrimination, and condemnation. The condemnation word. Hide them away, remove them away, and somewhere see to it that they do not get somewhere the family prestige declining. Because of the family prestige, जो कहते हैं परिवार की इज्जत के लिए कई बार इलाज नहीं कराते हैं majority of them, and they think that getting the young girl married, getting the young boy sent away somewhere else might actually cure the illness. These are not major illnesses. I'm just sharing with you what happens in day-to-day life in the schools. And are we forgetting that substance use and mental health today are partnering with each other in the big way? At least about 40 to 60% of children who start very fundamental substance use are affected by mental illness. And basic, I'm talking about tobacco, mild alcohol, and even ganja or charas, which is openly available. So we'll just keep this in mind as common ones. And all I mean to say is that it's a wonderful approach that we are all taking together. And I'm so happy that the mental health survey was conducted recently by the MANODARPAN team. And we also have the modular handbook for training of teachers countrywide ready now. I'm sure these flag signs are not far away to be understood. We need to get up, gear up well, and catch them young. We call about the Fit India movement, but why not catch them young for protecting their mind, mental health, and smiles also. Do not let the smile of a child deteriorate into an illness. And that's the systemic failure. It is not the failure of the child. The myth is that the biggest myth is also a social myth that ये बच्चे में कोई कमी है, उसी में कोई genetics है. It is, remember, nurturance of mental health problems by the environment are given much more credibility rather than the nature or the genetics of it. And on the contrary, genetic disorders, which could be partly mood disturbances or even schizophrenia type of illnesses. They also have been found that with good nurturance, good schooling, positive affirmations, positive reinforcement of emotional well-being actually cleans out, removes the complete vulnerability to mental illness. So why not we work on it? We need to have more research. Our institutes in the country need to put in their gear and do more research. We have enough fundings in the country. The health ministry should come forward to partner with maybe all the other departments. We need to have more counselors in our country. India needs about 3 lakh counselors in the schools. We just have about 10,000. We have just about 12,000 psychiatrists and we need about 1 lakh of them. So the manpower building is required to help the teachers. Manpower escalation is required to help the school counselors. And this is what the whole goal should be, to remove the myths and the misconceptions about mental health. I think I'd like to stop at that. Otherwise, the story can go on and on. Anything else which is desirable to be discussed, I'm always there. Thank you, ma'am.
Thank you very much. May I invite the next speaker? It is Saraf Kumar, Professor, Regional Institute of Education, Bhopal. Hello.
Yes, ma'am.
Yes.
Thank you very much, ma'am. Esteemed Professor Nilima, ma'am. Respected Dr. Jitan Nagpal, sir. Respected Professor Prabhat Kumar, sir. Dr. Susmita Chakravarti, ma'am. And all the dear participants, dignitaries from Jawahar Navodaya Vidyalayas, Kendriya Vidyalayas, state government schools, and all dear counselors. First of all, I express my sincere gratitude to each and everyone who are joining this platform to sharing and to discuss about mental health issues and mental health and wellness program in school. Really, it is the demand of the time. And this is the high time when we have to think and discuss about all these issues. So thank you very much to each and everyone. And already Madam Professor Nilima has discussed about barriers and challenges in her opening remarks. And Dr. Jitan Nagpal sir discussed about myths and misconceptions related to mental health issues. So now I'm going to discuss about gaps in implementation of mental health and wellness programs in schools. And to discuss about gaps in implementation of mental health and wellness program, I conducted a very small survey. And as a teacher educator, as a coordinator of diploma course in guidance and counseling, RI Bhopal, I think that we all are aware about the gaps in implementation of mental health and wellness programs in schools. So I just conducted a small survey, and all my counselors, teacher educators, headmasters, and AHM, I just conducted the survey, and on the basis of that survey, I identified and I tried to discuss the gaps in implementation of mental health and wellness programs in schools. I just want to start my presentation with a few lines, just starting paragraph from National Education Policy 2020. And in NEP 2020, in the first paragraph, there is written that education is fundamental for achieving full human potential, developing an equitable and just society, and promoting national development. So if we just make one triangle, on the one end of the triangle, there is individual, or we can say the child. On another end, there is society. And on the third end, there is the nation, or we can say our country. So if we want to develop, if we want to develop full potential in our students, and if we want to develop equitable and just society, and if we want to make our country developed country, then education is only the tool through which we can do this process. In the end of this paragraph, it is written that India will have the highest population of young people in the world over the next decade. And our ability to provide high quality educational opportunity to them will determine the future of our country. So we have this, we can say that we are quite lucky that we have such a huge young population. And if we want to use this young population, then we have to train them, we have to just educate them. And in all the sessions, just before this session, Professor Dr. Nagpal sir, Professor Nilima ma'am were discussing that if we want the holistic development, then for holistic development, we have to give equal weightage to the mental health. What is happening at present, we all are aware that in our education system, especially in school system, our focus is quite on cognitive development. But this is the time when we have to give equal weightage to the cognitive development, to the mental development, to the emotional development, to the social development and character development. And this is the spirit of our National Education Policy 2020. So now I come to my topic, that is the gaps in the implementation of mental health and wellness program. And for this, as I already mentioned, that I conducted a small survey, and in this survey, I just contacted to the 60 participants, 60 respondents, and these are the PGTs, PGTs, PRTs, teacher counselors, HM, AHM, and few administrators. And they are from Jawahar Navodaya Vidyalayas, Kendriya Vidyalayas, state board affiliated government schools, CBSE or ICSE affiliated private schools, and other government schools and other private schools. So these are the 60 respondents from these schools. And location of the schools, in the 60 respondents, I have taken from both urban and rural. 53.3% respondents are from urban, and 46.7% are from rural background. Now, my question was, mental health and wellness program is properly implemented in your school. So in this, you can say that maximum number of respondents, they are saying, yes, it is properly implemented in school. Though I consider the previous data, that in this data, it is clear that maximum number of respondents are from Jawahar Navodaya Vidyalaya and Kendriya Vidyalaya. That's why I think that this data we can see. But still, I think that if we consider this data, then we can say, yes, now there is a little bit, or we can say due to several initiatives after COVID-19, the ministry has taken this initiative of MANODARPAN, and through which several programs are conducted, continuously we are conducting for our schools. And that's, this may be one cause that our most of the teachers or the schools, they are implementing this program. And at the state level also, various initiatives has been taken by various state governments, state boards, and this may be the reason that now this such type of programs are being implemented. Now, my next question was, is school administration or management actively participate in implementation of mental health and wellness program for schools? Now, again, we can say that approximately 69% are saying yes, and 15% is saying no, and 16.7% is saying can't say. So again, with such limitations, I am saying that yes, our administrators, managers, they are interested and they are taking part in the school mental health wellness programs. The next question was, proper support is provided by the school administration or management in the implementation of mental health and wellness program? Again, we can say that approximately 70% population, 70% respondents are saying yes, they are providing support. In the next question, I asked, school teachers are aware about the mental health program and mental health and wellness program. The data is approximately say that 66.7% say yes, school teachers are aware. Again, I am saying that maximum number of respondents are from Jawahar Navodaya Vidyalaya and Kendriya Vidyalaya, and few teachers are from state government, state board schools. But still, we can try out, we can find out a few solutions or a few gaps through this data. And I asked one question: did any orientation provided to teachers of your school about implementation of mental health and wellness program? Then 50% here, 50% teachers are saying yes, and 50% teachers are saying no. So this somehow reflect that there is approximately 50%, we can say 50% population is there, 50% teachers are there, who are saying that they have not received any orientation about mental health and wellness. Now, I provided some questions to them, and I asked what is their opinion about these questions. And these are basically the gaps. And again, in the last, I will discuss all these gaps one by one. I asked that administration or management are not oriented about or not aware about the mental health and wellness program. Then here, I am receiving, so here is some contradiction, but we can say that 41.7% teachers or counselors, counselors, they are saying that administration or management are not oriented, they are not much aware about this mental health and wellness program. My next question was teachers are not oriented about the mental health and wellness program. So 36.7%, lack of parent support, again 38.3%, overloaded curriculum. So these are the gaps. We can, percentage is not very important for us, but the points that administration or management not aware, teachers are not oriented, lack of parent support, overloaded curriculum, more emphasis on academics. These are the some points on which we can say that these are the gaps. Is my screen visible to all of you?
Oh. Yes, yes. Right now, we can't see anything. I think it is not being shared.
Okay, I'm again trying to.
Dr. Saurabh, आपका screen share presentation का नहीं आ रहा है.
Okay, ma'am, I'm again sharing.
And I'll take this opportunity just to intervene a little bit. All those who are, having your speakers unmuted, kindly mute yourself. Thank you.
I think through this laptop, through which I am sharing the screen, it is not connected to Zoom. So kindly connect this one to Zoom. And I think I should continue. And now there are some points. So I take one by one. And if it is not visible, then it will be okay. I think it will take time. So I continue. Now I take one by one points, what they have suggested, that what are the other gaps in implementation of mental health and wellness program in schools. First one was higher authorities not providing a proper plan and period. When I discussed to the counselors are again and again reporting that there is not a proper plan for counseling. And what happens that sometimes the principals or other authorities, they provide them the remedial classes or the arrangement classes. There is not a specific period for counseling. So when there is no teacher available in the school, or there is something to just engage the students, they provide the class to the counselor. So this is, I think, a big gap where we have to work. More attention in academics. Already all the speakers, they were discussing about this point, that our entire focus is on academics, and it is not bad, but the only our orientation or our focus on product, this will not help in a long way. So we have to think that mental health and wellness, it is mandatory for each and every student, and without proper mental health and wellness, no one can achieve the goal. So this is the gap on which we have to work. Rigidness of management, taking mental health issues not seriously. And again, we have observed that there are so many, we can say, the authorities or the in the schools, especially we can say the schools in rural areas, or we can say the schools where there is not adequate staff. There, what is happening, or the counselors are continuously reporting that they are not giving much emphasis on mental health. So this is again, we can say, a gap on which we have to work. And another gap is when students are also properly oriented about mental health and wellness, it is very much required for their all-round development. They can freely share their mental health issues with teachers, counselors, and even with principals also. So now, as well as we have to continuously work with the students. We have to motivate them. We have to provide them opportunities. We have to provide them sessions. We have to conduct some workshops, some seminars, especially for our students. Or we can say, we can conduct some special type of programs so that our students can be motivated and they can freely talk to their teachers, to their counselors, to their principals about their mental health issues. Lack of awareness about mental health. Already Dr. Nagpal sir has discussed a lot about this aspect, so I am not taking much. Absence of fair regulatory body to check. It is one suggestion given by some counselors. This is my observation, that in our society, there are various types, there are so many NGOs, they conduct some camp for physical checkup. And I think in each and a small town or city, there are some camps organized by NGOs or the government for physical checkup. So can we think to organize such type of camps for our students to orient about mental health issues? This is just a suggestion. Illiteracy of parents and lack of knowledge in rural areas. It is again in rural areas we can see that there are so many parents, they are not aware about mental health issues. As Dr. Nagpal sir was discussing, I have also, when I was conducting one program for tribal principals, then they told me that there are so many students in each and every batch, when just before prayer, they start dancing. Every day, 2 or 3 students, they conduct such type of activities. So again, this is not a small issue. This is a big issue. Not only one principal, I think more than 5 or 6 principals, they just explained the particular case that every year students are coming in their schools. So again, we have to work on this. Not considering mental health a priority, lack of human unity. So these are the 2 points. One is we are not giving priority to mental health. And I just ask one question to each and everyone. Is there anyone who have not ever fell ill in his life? I think there will not be anyone. I remember that several times every year, once or twice, I just go to physician. If there is some environment change or there is something, suppose, then we go to physician and we need physician. Similarly, due to various situations, it may be, we can say the pandemic like COVID, or there may be several societal or family issues, but our mental state is not always same. So when we need physical fitness, we need physical testing and all these things. Similarly, we have to work on mental state also. It must be planned in timetable of school level. It is again the repetition of the same thing that counselors are reporting, that in timetable there is per week there is only one class, or there in several schools there is again I am mentioning that there is no period for counseling. What is happening, that any remedial or arrangement classes, counselors are sent to the class. So it is, we have to give in due weightage to the mental health and wellness program in school. It should be reflected in our academic calendar, in our timetable. Another gap is the principals must give training and take it initiative to improve the system. Definitely, the principal, the headmaster, and the AHM, these are the we can say these are the implementer of this mental health and wellness program in the school. So they should take initiative, they should take interest, they should take this initiative and implement in the school system. So when they will take interest, then definitely this program will go to the roots. Lack of self-motivation in teachers due to lack of training and orientation. Again and again, this issue is raised by the teachers, the counselors, that teachers are not properly trained about the mental health issues. As Dr. Nagpal sir was discussing, that at present in India, we need 3 lakh counselors, and at present we have only 10,000. So we need training of counselors, as we need the pre-service training, in-service training. Such type of training programs should be, Government of India and all authorities, they should plan such type of programs so that according to the demand, we can prepare the counselors. And another one is, there is not any stage-wise plan and implementation strategy. As the earlier speakers were discussing, that each and every stage, there is the need of counseling, guidance and counseling. There is need of mental health and wellness program. In early stage, it should be for habit formation, for habit development. And in each stage, there is need of guidance and counseling. So stage-wise plan, in every school, every board, in every system, they have to develop the stage-wise plan and its implementation strategy. Separate budget should be allocated for such activities. Some counselors also raised this issue that there should be provision of some budget, and that should be utilized for mental health and wellness program, and frequent communication between parent, child, teacher, and management. It is again a gap that there is not a proper coordination amongst various stakeholders or various bodies. And this is the program where each and every individual, the participation of each and every individual is must, mandatory. Without the participation, if suppose we think that this is the work of the counselor, this is the work of the teacher counselor, then we cannot fulfill our purpose. So we should work together, and I think if we work together on these issues, we can definitely fulfill these gaps. So this is from my side. Thank you each and everyone for listening in. Thank you very much.
Thank you, Dr. Saurabh. So now I invite Dr. Susmita Chakrabarty for her presentation on addressing the challenges in implementation.
Thank you, sir. सभी को मेरा नमस्कार, और क्योंकि मेरे पहले दो speakers, Dr. Nagpal and Dr. Saurabh, have beautifully explained and shared the different difficulties when we talk about mental health issues. Both regarding the myths and the misconceptions, as well as the gaps in implementation of the mental health and well-being programs in schools, I will try to focus on the ways through which we can address these gaps, we can address these misconceptions and myths, and how, as since all of us here are school administrators, तो हम लोग as school administrators, as leaders in the school ecosystem, क्या भूमिका ले सकते हैं, किन चीजों के ऊपर हमारी ध्यान रख सकते हैं ताकि जो mental health and well-being को लेके गंभीर समस्याएं उठ के आती हैं उसको हम लोग minimize कर सके और effectively positive health and well-being को promote कर सके. To begin with my sharing, I will like to bring in back to the notice about two most important things. One is about the fact that, which Dr. Nagpal pointed out, that the World Mental Health Report says that, and we have adequate data, both international and national level, that around 14 years of age, approximately, mental health issues start being noticed in students. Now, this important information has two very significant aspects. One is gearing up the school's ecosystem to have effective remedial measures in place. The other important factor, which I personally feel, being a person from the mental health, is that this data gives us also an important information that we have previous 14 years or 13 plus years of time to reach out to the students such that they do not require remedial measures. So this data also gives us scope to see that we can have adequate time to create proactive and preventive measures so that every child is able to I request all participants to kindly mute yourself. I request all participants to please mute yourself. Okay. So thank you. Thank you once again. The other most important factor that came up was when Dr. Sheshadri, in the inaugural session, which you all heard, is that every child every child whom we say are juveniles, whom we say are, children in conflict with law, are actually the ones who had need for care and protection. So before one becomes a juvenile delinquent, or before one goes to the stage where there is need for treatment, need for therapeutic support, need for going to the psychiatry or to the help, or jaise Dr. Nagpal bhi bol rahe the, there are many other alternative things which happen, like jhad phook, tantric and other things, alternatives, non-formal ways of reaching out to such issues. We have opportunity for providing care and protection to students. And which place is the most significant place after home is the school and education. These two factors, the school and the education, are the most important places of any child and every child's protection issues. Protection not only from their physical, but also psychological, emotional, social. So in this backdrop, and taking cognizance of what was bar being told in the morning session, that we must remember every time when we are interacting in the school, that the students who are there in the school, not just the students, but all other people in the school system, whether it is the right from the security guard up to we all as the school heads, the school leaders, the lab assistant, the librarian, the cleaning staff, of course, our teachers, each and every one is an emotional being as well. So addressing that emotional well-being of this emotional being individual is an important and integral part of our discussions when we talk about promoting mental health and well-being in the school ecosystem. So to take forward this discussion, I would quickly take you. Just a second. Sorry for the sharing of the presentation. I think it will be taken care of in 2 minutes. Quickly, before I go to the points, I would like to draw your attention to again the NEP 2020, which says category, next slide, very quickly, very categorically, that for every child, every children to perform optimally in their learning, in their education, they need to keep them in good health condition, and that includes, very clearly it's written, including the mental health. And for this, it is not just important that their physical health is taken care of, but also the policy talks about well-trained counselors, social workers, and most importantly, if I can draw attention to all of you to the fact that there is involvement of community in providing this support system in the school. Next slide. Next slide. So yes, keeping a quick glance to what Dr. Saurabh was also mentioning as to what has been the challenges are what Dr. Nagpal mentioned and focused upon is the various myths and misconceptions about mental health and well-being. Second is the gaps which are related to the functioning of mental health functionaries. The understanding of what is the functioning of these functionaries in school system. As Dr. Saurabh's presentation showed, that there are very glaring gaps. And thirdly, the lack of sufficient adequate resources for effective implementation. Now, these resources, what kind of resources? It can involve all kinds of resources, starting from the infrastructure to providing of spaces, time, funds, and of course, training, capacity building, etc. Next slide. Now, a little bit about the details about it, the misconception and myths. May the sabse pehla thing that comes up is dealing with the stigma. Why it is important for us to again and again go back to identifying these gaps or these, glaring gaps in our promoting of mental well-being is that these gaps or these notifications are the ones which will help us to address them separately. So when we have been able to identify, I again request all participants to kindly mute yourself. Thank you. So the more we are able to identify and become aware of those gaps, of the myths and the misconceptions involved, the better will be our strategies to address and minimize these issues. So with gaps of related to mental health and functioning of the mental health functionaries in the school, as you can see, it is many administrative issues which are there, some of which were mentioned by Dr. Saurav Kumar, and things like it is of issues of allocating time separately, things like providing of adequate spaces, things like having provisions in the school function, integrating it with the everyday school functioning. So these are the kind of issues that are that can provide significant role in addressing the gaps of the mental health functionaries. Of course, along with this, what Dr. Nagpal also highlighted is the skewed demand and supply. This is, of course, there is a huge gap between the demand that is there from the schools for professionally trained counselors and the actual supply. Keeping in mind the population that we have in our country, we need to devise strategies. We need to relook at the approaches that we are having right now, which can minimize this. Of course, along with this, there is need for promoting and seeking more of trained counselors in our school system. And when we have those such counselors in our school system, it is important that we give and extend entire support to their functioning. The third is of lack of sufficient resources for effective implementation. And as I said, there are lack of physical resources, lack of financial resources, there's requirement of provisions for fundings, etc. Again, he's gone. So unfortunately, I think the slide presentation is not going ahead. A second. पीछे जा रहे. Right. Thank you. So for addressing the challenges, dear friends, the three pivotals that we have, three pillars that can address are: number one, preparing the school system with an approach of the whole school. Often, as I said, that one of the misconceptions is that mental health issue is something that will be dealt by the counselor alone, and that it has to be done as an episode kind of thing. So whenever there is a problem, examination time में students को बहुत anxiety होती है, stress होता है, so at that point of time, let the counselor take over. या फिर whenever there is a case of running away, absenteeism, or lack of performance, again academic performance, or some kind of bullying issue coming up, some kind of ragging, some kind of stealing, behavioral problems, other kinds of mental disorders की issues आती है. Only as such occasions we think about the intervention of a counselor. But such kind of episodic and remedial preparation probably is not what is the need of the hour, as we have all understood so far. So preparing the whole school ecosystem to gear up to address the mental well-being, to promote the well-being and not wait for some kind of negative impact on their mental and emotional health is the first pillar on which we can address the challenge. The second is of elimination of the different misconceptions about mental health issues. Now, when we talk about this elimination of misconceptions, I'm sure सबके मन में आ रहा है कि ma'am, how do we do this? We are all sensitive, we are all aware that this is a very important factor. But then how do we take care of this misconception? Many a times we hear from the principals, from the teachers that, madam, उनके परिवार में इस चीज को लेके बहुत सारी गलत फहमी है, बहुत सारी गलत धारणाएं हैं, तो उनको हम कैसे डील करेंगे? At school level, how can we do that? So yes, there are ways through which, and we have to find out ways to reach out to the parents, to the community from where our students are coming, to remove this kind of myths and misconceptions that they are there. And along with it, we also, in the school system, within the school boundary, we have to develop such mechanisms through which we can do. In my following slide, I will talk about some of them as much as I can talk in this brief time that we have. The third pillar is of equipping and building the capacity of our teachers, whom even Jansen ma'am, while addressing in the inaugural session and through our eminent speakers, we all have been hearing that teachers, every single teacher has the potential to function as the first level counselor. And the new education policy has very clearly mentioned this, that every teacher does need to extend the socio-emotional support to each and every student. A glaring example we heard when in the morning Dr. Shishadri talked about that particular student who after 20 years, having grown up into a full functioning adult in the society, remembers when he was a young student in the school that how kind was his teacher to have understood his non-verbal communication, that he's undergoing a lot of tension. His family is going through some tension. And so noticing that, he called that student out. That kindness, not only that kindness, but also the respect of his confidentiality. So these kind of things which a teacher can do. And for this, there is of course no separate need to, to bring in different kind of interventions, to bring in different kind of training programs, orientations, and etc. It's just all requires is to encourage our teachers to become socio-emotional support system for every student in the class, and our school, entire school system becomes an environment which is not only physically safe, but socially and emotionally, mentally safe and supportive to each student. Can we, next slide. Yeah, so some of the things that we can do as a whole school is what you can see on the screen, starting right from what is our vision and mission statement. Does it include promoting mental well-being, promoting emotional well-being? Kind of teachers' capacity building that we do both at the in-service and at the pre-service. How much of encouragement do we have, do we extend to our teachers to ensure that their students are in a state of mental well-being and emotional well-being? Also preparing a large number of cadre for professional counselors in the school system, bringing them in the school area of work and giving them the support that is required to reach out with their professional help into the schools, into the school systems functioning to the students. Why I again say the school functioning is because the school has a lot of processes that we all know, right from the assembly to the midday meal duration, to the lunchtime, to the playground, within the classroom, in the corridors, in the labs. All these are spaces, different spaces where people are interacting. The students are interacting. The students are not only interacting with themselves, but students are interacting with their teachers, with the staff. So these are all opportunities and spaces, dear friends, where we can promote mental health and well-being. Of course, the need for guidance and counseling, cell, guidance committees, a calendar, that was even Dr. Shishadri pointed out, that having a guidance calendar, which will include promoting and planning of activities, several activities throughout the academic year, integrate it with the academic activities about and focusing on mental health and well-being of the students and other stakeholders in the school system. So like this, there are many other areas on which we can focus upon as a whole school approach. Next slide, please. So the next one is, next slide. Yeah, the one that I was talking about is elimination of misconceptions about the mental health issues. Now, as you can see, the most important thing of eliminating any kind of misconception or myth or attitudinal change requires integrated, perseverant, persistent efforts on sensitizing and awareness of all the stakeholders. And when I say all the stakeholders, it includes the parents, the community, the school members like teachers, school staff, and other resources that are available near and around the school. The second is about creating appropriate opportunities and developing our teachers in the school as resources who can promote the well-being. Also creating and providing such kind of other resources that can help to take forward the emotional well-being and mental health issues with the students and others in the classes in the school system. Next is establishing and providing the frequent linkages as part of the everyday functioning in the school. Such linkages with the parents, with the community, will break the kind of communication gap, understanding gap between these two very important partners in a student's learning environment. So such linkages needs to be planned and needs to be done on different, and these linkages can focus on addressing the different myths, misconceptions about mental health issues. Next is probably creating and developing a lot of dissemination materials, advocacy materials, and bringing in our own schools, community resources like public health personnel are there near your schools. We have many psychiatric hospitals around there who can be brought into the school, who can reach out through the school to the parents and the community. So such kind of dissemination mechanisms can help to break misconceptions, bring the clarity amongst all in the school regarding the mental health issues. And of course, as I said, allocating adequate amount of funds for developing these resources is very, very important. I shall quickly wind up with the next slide, and that is about, sorry for the typing error, it's socio-emotional and not socio-economic. The teachers play a very important role, and knowledge and skills of guidance and counseling is an integral part through which teachers need to be trained. They need to be encouraged to be trained in this, and integrating assessment and appraisal on this important aspect of guidance and counseling and promoting, encouraging positive mental health and well-being is also an important part of building up our capacity of teachers to be extending socio-emotional support to our students. The second important factor is to encourage and facilitate our teachers to become first level counselors and to extend support to the professional counselors in the schools, so that not just the counselor alone, but all the teachers become a team who reaches out to the students, both for prevention and proactive measures, as well as for the remedial measures, students as well as their parents, their community members, the school staff. So thank you for this, and for hope that this gives a kind of clue to how we can step out with promotion of mental health and well-being and emotional well-being among our students in the school system. With that, I will end my presentation. Thank you.
Thanks a lot, Dr. Chakravarti. So we thank each of our three distinguished speakers for their wonderful presentation. So now we invite questions related to these three presentations. If you have any questions, please ask.
Or they can type in the chat box.
Or they can raise their hand. Okay, chat box is closed. So you can raise your hand then.
Some Mr. D. Turkey or something.
Mr. Turkey, please go ahead.
May I? Hello, can I raise a question?
Your name, please.
I'm Dr. Joy Joseph.
Yes, what is your question?
It is not a question, actually. It is a sort of suggestion only, because in the schools, what we always see is that guidance and counseling is taken up only when there is a problem. So how to enhance the use of guidance and counseling as a preventive measure? We have to develop some mechanism, because it is not compulsory part of our curriculum, so it is not being taken care. What can be done about that?
Any of the resource persons, experts?
Yes, ma'am, I'm coming in. So yes, sir, I agree, Kabir. I think all of us agree with what you have raised. Very pertinent observation. And that is where the first approach that I talked about, the first pillar, is about the whole school approach, where we take in the entire school's functioning, the school process, and not just keep guidance and counseling as an episode where this waiting for an episode or an occurrence to happen where guidance and counseling will be taken up for. So when we plan, like you are right that in our curriculum, in the guidance and counseling is not kept separate, and honestly we do not want it also to be kept separate. It has to become like any other integral part of our school's functioning. Like we have the morning assembly. In the morning assembly itself, we can include issues related to mental health and well-being. We can also, there are so many opportunities in the everyday schools functioning where we can integrate mental health and well-being as an issue. And guidance and counseling is that strategy through which mental health and well-being is addressed. So if we identify the issues with which my school is working upon, which is of high concern in my school, then accordingly, when we prepare our academic plan, we can include this along with that academic plan and place it in such academic activities so that it becomes an integral part of its functioning. For example, we have debates. So why not bring in an issue which is mental health concern to have a debate? It's just an example that I'm trying to put forward. Thank you.
Dr. Sunita Singh. Dr. Rajesh Sharma.
Sir, Can you hear me, sir, now? Good afternoon. So can you hear me now, sir?
The voice is just broken.
Sir, are you able to hear me? Sir, are you able to hear me?
Yes.
Sir, can you hear me?
It's
Yes.
okay, fine,
Yeah.
fine. We're
Sir,
hearing.
my request is, yeah, my request is, when we are having the B.Ed program going on, we still have not included mental health into much of the teachers' syllabus. Are we having any future plan for it? Thank you.
Dr. Chakravarti, you may respond.
Thank you, sir, for raising this issue. And it is of, I think Professor Nilima Bhagwati will also be highly elated and, encouraging to share that in our national curriculum framework that is being framed, the new policy since has given a lot of impetus on counselors and mental health issues. Amongst the 25 position papers, there is one position paper focused on this area. So bringing it in the curriculum, that itself says that it is going to become an important and integral part of the curriculum, right from the framework to training of teachers to other training areas, material development, and etc. So yes, we all as ambassadors of mental health and well-being, we can look forward to the coming years of having it in our systems functioning. Thank you.
And it's going
Thank you,
to
ma'am.
be.
Thank you.
KV Balagat.
This is Pankaj Kumar Jain, Principal KV Balagat. What I observed in my that Balagat KV, I see the student is lot of change in class, particular 8th and 9th, because the adolescent change is coming there, and problem is coming. Identity crisis problem is there, and they are bullying each other. Opposite sex also they are sometimes bullying each other. So my problem is that my question is that how we can overcome this such type of problem. Is there any specific idea for that such problem to solve this such type of problem?
Will be any of the experts, please?
Dr. Saurav, are you there? Or Dr. Susmita?
Thank you, sir, for raising this question, which is actually an everyday scenario in our school systems across, not only in KVs, I guess it's there in our Navodaya Vidyalayas and other school systems also. All school systems, all schools have the same issue, and as the principals, as vice principals, as teachers, as parents also. And we all have this concern, and how do we stop it is the question in our minds. True. So the question, the way to stop it is, sir, about what we are all talking right now here. And that is the answer. Not only having encouraging, which Dr. Saurav was also talking about, having workshops at group level, having group guidance activities, like having group discussions, having panel discussions, having experts coming over and talking to them about the issues in the group, as a school, as a class, the whole school, the whole class needs to be addressed, so that each and every student, not only the student, but also their accompanying adult caregivers, whether it is their subject teachers, whether they are class teacher, whether it's their lab assistant or their librarian, they all become aware of this issue. And the students, along with the students, they understand the merits and the demerits, the pitfalls of these kind of behavioral issues that are there. And of course, along with it, of course, there are remedial issues, remedial ways like providing group counseling, to students who are the bully or the ones who are the victims. Also, of course, one-to-one counseling is definitely there. And along with it, also such preventive measures like having workshops with, different age groups, different टीचर्स के साथ वर्कशॉप्स, पेरेंट्स के साथ वर्कशॉप्स, कम्युनिटी के मेंबर्स के साथ वर्कशॉप्स टू ऑल्सो help them understand that this is a common concern among the students and how as caregivers we can deal, we can manage, we can empower our students to face these issues, to equip them and take it forward. Alone as a teacher or as a school head, maybe we can fall short. But when we all are there as partners, as caregivers by the side of the students, then we can deal it very effectively. Thank you.
I'll just add it to what Sushmita has said. Like from my end, for the last 4 years, in fact, I have started the workshop, which Sushmita is saying, from my own NGO, with the help of my earlier, former students who has enough sort of knowledge in mental health, etc. So my workshop, it deals, on the theme, teacher empowerment and parental empowerment. So here, whatever you're saying, because this adolescent stage, it is, like it is very natural, certain problems crop up. Oh, so those should be disseminated, those should be made understand, those should be explained very nicely. And it is not once in a year, very frequently these kind of workshops should be held. And obviously, you can sort of come to the solutions. And I have found it from my own exercises of doing it. So it will be we have to reach out. We have to reach out to them. They will not come to us. We have to reach out to them. And this will be really indeed a wonderful service, we'll be giving in the field of mental health. Thank you.
Thank you, madam. Thank you, madam. A wonderful session.
Any more question?
May I have a question, sir? This is Principal Kendra Vidyalaya, Brahmpur.
Yeah, please.
Sir, as you discussing today, just now in session, implementation of the guidance and counseling in the schools. First of all, there is, I think, 3 to 4 issues. First one is appointment of the counselors, as well as the availability of the proper counselors in the locality. Because just only getting psychologists, they are not the counselors. Educational counselors need to be trained in different way. Point 2 is acceptance. Till now, the schools, the community, and the children and the colleagues of the counselors are not able to accept the role of the counselors. So it needs that we should train our own teachers how to use the counseling services and guidance services as a part of preventive measure, not only the afterward issues. And third point is, we must plan in our academics. There will be a period, and there should be in academics, the small stories, maybe the real stories. As we discussed in the morning session, there are a lot of stories, which is the real in nature. And out of that, we have gaining some knowledge. And the stories, by changing the names, we can input in our academic books. And the teachers will be guided that they must discuss in the classrooms so that the students will come up with their own problems and we can help to develop their mental health and we can bring from negativism to positivism. This is my concern. I should request you to use as input if it is possible and the house agrees with it. Thank you.
Would you like to respond, Dr. Susmita?
Thank you, sir. In fact, we join with you with your concern, and since it's a common concern with all of us, that is why this conference of 2 days is the first step towards there. When we have our school administrators and all our principals, vice principals, teachers, teacher counselors understand and find a way forward, we will be able to take it in our everyday functioning in the schools and create opportunities by ourselves in the everyday school functioning to promote mental health and well-being in our school activities, in our academic activities, in our sports activities, in our all the processes that undergo, right from entering the school in morning and leaving the school in the afternoon. So all those places are where we can promote, and yes, this is probably our first step towards that. Thank you.
Thank you.
I think the time is over, maybe. Let's see.
Yeah, time is already over. So in this session, our distinguished speakers focused on different barriers and also suggested some of the ways of addressing these barriers or challenges in implementation of mental health and well-being concerns in schools. Various myths and misconceptions related to mental health and well-being were also dealt with by Dr. Nagpal. So now I request Professor Neelam Bhavati ma'am to please summarize this session.
Thank you. Well, it was indeed a very impactful, I should say, session. And the challenges or the gaps were very much focused and how that can be overcome. And the third speaker has already given a roadmap, so as to say some of the suggestions that how those gaps can be filled up and how the challenges can be met. Regarding the first speaker, Dr. Nagpal, he just said one very important thing, which all of us need to understand very clearly, that mind is a component of good health. That's understood. It is not something separate. That's what they understood. And he also stated about the early intervention is required. Early intervention is required, which is actually very much being ignored. Just few days back, about a week back, I went to one of the district nearby, and a child who is, yes, I'm just telling you very briefly, a child who is not even 5 years old, she sleeps the whole day on the bed, she never gets up, and the parents are observing it and saying that the child is sick. She's not sick, she's having some problem, but there is no intervention. What is the problem with her? And as it is already said in the meet, they'll take her to some of the Charafuka, we say it, or the Tabich giving and all those problems. And ultimately, what I want to say by this, that these kind of things are big challenges and we have to remove it from the society. If we really think of the mental health, we have to reach out to the society, reach out to the community who still believe that some power will come and just the girl will get well. They don't know what is the role of psychiatrist, what is the role of the social worker. They don't understand. So these are some of the things which was very much sort of well focused in Nagpal's presentation. And when coming to the second speaker, Saurav Kumar, he also spoke about, practically, he said about the gaps, and the gaps, for your information, Saurav Kumarji, like I also found most of the same gaps. Just recently, I was talking to Sushmita yesterday morning that I did a very quick survey in some of the schools in Guwahati government schools. And whatever you say that the no plan of mental health, or they stress more on studies, more on result, and the rigidness of the management, or not in management, the rigidness of the administrator or the principal. So these are some of the big challenges which he really focused, and how the lack of parent support, it affects the mental health. The children also are, largely they are affected. So all these are very much clearly said by him. And the last speaker, Sushmita Chakraborty, Dr. Sushmita Chakraborty, very nicely presented her challenges, that what are the challenges regarding the supporting system or the awareness, all very systematically. And most important is there is no teamwork, all are separated, they still, everybody know their own compartment. They do not like to sit together and discuss the matters which are related with mental health issues. So lots of problem. Even she said about the training, she said about the budget provision, she's about the demand and supply, etc., etc. So all the three speakers very nicely, very systematically, they have given their presentations, and I'm sure this will be very fruitful if we can then bring out very systematically how to make the roadmap, how to implement it now. That is more important. The session speakers said, and we have to now implement it, and for that we have to make the very constructive, very impactful roadmap for it, that mental health. And it is going to get a very important place now because of the national education policy. That is assured, that is assured. Thank you very much, all the speakers. And We all benefited quite a lot from your presentations. Thank you very much.
Thank you, ma'am. Friends, so the present done. Dear friends, now the second session after lunch is about to begin. So I welcome Professor Flore Dakar, who is Dean of Instructions in Neri, Shillong, and in charge principal of Northeast Regional Institute at Institute of Education in Shillong, Professor Florette.
Thank you. Thank you, Dr. Sushmita.
Hello, ma'am. Welcome.
Namaste. And a very, very warm welcome to each one of you, members of the MANODARPAN cell. We have the distinguished chairpersons, the distinguished paper presenters, the school principals, the teachers, and everyone who are part of this national program. As the theme for this year relates with making mental health and well-being in schools and a global priority, I invite each one of you to this session. And here in this session, we will be focusing on mental health issues of students. What are the preventions and what are some of the interventions? Now, as the session will be focusing on students, just briefly, I would just like to remind each one of us about these students who are there in the classrooms. Let us look at these students who belong to inclusive classrooms. A girl child, a boy child, a child with a disability, a child without a disability, a child who comes from a difficult background, a child who does not come from a difficult background, and so on and so forth. So therefore, as we focus our attention on the prevention and interventions which we can help our students, I therefore, again, I would like to remind you to make it inclusive so that each child will be able to benefit from this session. Another important point is that why is it that we are focusing on the child? We will be focusing on the child's mental health because it is the right of the child. And as administrators, principals, as teachers, we just cannot violate any of these rights. For this session, we have 4 speakers. And before I call them, first of all, I would like to mention what the session will be focusing on. The first will be on mental health issues in students across different stages of education, academic, emotional, cognitive, and social. The second paper presenter will be focusing on early identification and intervention as protective and proactive factors for enhancing mental health and well-being among students. The third will be on mental health and schools, empowering students to be change catalysts. And the fourth will be on integrating mental well-being with school curriculum and pedagogy. The 4 sessions, they really sound so interesting. And without wasting much time, I will call the paper presenters one by one. But because of the time constraint, maybe we will just be able to give 15 minutes for each paper presenter, and so that we can have some time for interaction. So I therefore first invite Mr. Ramachandra, who retired as the Joint Commissioner from the Navodaya Vidyalaya Samiti, and Sir will be focusing on the theme, the sub-theme, mental health issues of students across different stages of education, academic, emotional, cognitive, and social. So I hand the session to you.
Good evening, ma'am. Thank you very much for giving me the opportunity. I hope my audio is okay, working well. Yeah, thank you. Thank you, one and all. Thanks for the chair for giving me this opportunity. Thanks to NCERT for taking up this huge activity in a very right time. Having worked long in the residential school systems, and I'll try to address the issues from that perspective to begin with. I worked for a longer time in the residential school system and would like to take references from the residential school systems during my talk. It's really heartening to know that more than 250 people are participating in this, which indicates that this issue is as serious as anybody can imagine. I would like to although the topic given is academic, emotional, cognitive, and social issues, stages for thinking about, I'll be concentrating mainly on the academic issues, which also overlaps with the other stages. Being able to recognize and support mental health in schools matters very much, because several problems of the children look childish to the rest of the people. What is not a problem for elders may be a very serious problem for the child. I just happened to meet an agricultural laborer, a very young child, girl child, who is also a disabled, was working very fine. I found her to be very extremely creative and very well communicative. I just asked her a question: why didn't you pursue in this school? Pursue this school? Back came the reply. She said, I couldn't make out what they were telling was. That was reason number one. The second reason, she said, it's a very silly issue. That's why I'm just referring to this. She said the school has toilets separately for girls, separately for boys, but both of them are located in the same place, in the same direction. This somehow did not cause an appreciation, rather, I could not appreciate this. So she just dropped out of the school and joined the agriculture labor. So just imagine the types of issues which the school causes. The second issue I just wanted to refer is, most of these problems, what is pursued by the child could not be resolved if, could be resolved very effectively if identified at very early stage. Many issues, the third one is, many issues are resolved by family, friends, and close associates, which we are all aware. Only limited number of problems get manifested in the school atmosphere, which is visible to us as educators. Early detection and intervention strategies therefore work. They can help improve resilience and the ability to succeed in school and life. And the other issue I just wanted to make out is, many issues are not necessarily cognitive, but related to social and emotional issues. And one more issue I just wanted to make it very candid, with the permission of the chair, that it is not necessary that the people who cause intervention for better mental health are totally free from mental issues or disturbances or confusions. It may not be illness, but probably not normal. Dr. Nagpal and Professor Saurav gave a clear view of this issue very clearly. I would like to take a few examples of the evidences or symptoms we get in the residential schools of the deviations of the student. For instance, a student is not participating in the midday, lunch. What it indicates is the problem is just fresh, maybe less than 2 hours old. Then you look at the endurance capacity of the child, he continues further. The child is found silent and lesser participative in the sports and co-curricular activities, which indicates that the problem of the child is 1 to 2, 3 days old. Now, it comes next level. The unusual delay in coming out of the bed in the morning. The child is still examining and evaluating the issue. What it means is that the problem is getting deeper and deeper to the child. And now, next stage is not able to concentrate in the classroom activities. Either the child is looking outside or his attention is not in the discussions, what is carried on in the classroom. What it indicates is that the problem which existed in the child, which has begun a few days ago, has just caused deviation of mind for the child. Now, I go to another next level. Somebody, a chowkidar maybe probably, finds the child getting up in the midnight and then going to the bathroom. So this indicates that the problem has really disturbed the sleep of the child. It has entered deeper and deeper. What it indicates is the child has started thinking very strongly about the issue rather than his personal issues, because that is the time the child should have slept very well. The next stage is coming up in the reduced performance in the classroom. That means that the child has started expressing the issue in a different context. The next level, which we generally take it as an issue inside the school or on record, is abstinence, misbehavior with the peer groups, or some sort of things. Then the last stage is probably the dropping out of the school. Some of the students may drop, or some of them may still continue to pursue with some kind of pressure from outside. These signs are visible to different functionaries of the school at different times. This is what the point I just wanted to make it clear, that it is not the teacher alone who is required to observe the deviations of the children or the problems of the children. It is visible to many people at many occasions and at different places. The reason for mentioning for this here is to bring home the fact that each and every person in the school system need to be sensitive to observe the developments and responses of the students continuously. The academic issues generally, what I feel, cause lots of problems, even to the cognitive issues, whether it is confusion, motor coordination, loss of short-term or long-term memories, identity confusions, impaired judgment, any of them, it goes from scale to scale when the problem continues to persist or continues to bother the child from one period to the other period. However, these issues are dealt separately by different speakers. I've been observing from the morning that these points of cognitive as social and emotional issues are dealt more in detail. Therefore, I would like to concentrate on the academic issues. It's a well-known fact that the mental health has a direct impact on academic issues. It is also probably true that academic strategies have a direct impact on the mental health of the students. I give some of the cases for referring to this. For example, compulsive and formal methods of learning practices. I just give a small example. Say, for example, when we are teaching 3 dimensions, when we take this word dimension, these terminologies, dimension is used in a local language, in the in one of the vernacular language of a particular state. That is where we end. But we certainly know that the terminology does not exist to be the same across the state. All of us know that every 50 or 100 kilometers, the type of language terminologies used go in a change, and different terminologies are used by different people in different regions. Therefore, what is used in the textbook, what are the terminologies used in the textbook may not be understood by the child. And if the teacher fails to contextualize it and then give the local referred terminology to the child, he definitely is not rather duty bound to follow what is transacted in the classroom. The second case, which I am referring is, these are academic issues, underestimation or overestimation of student abilities and activities. This is happening most normally in the rural areas. I'm referring to rural areas because in the urban areas, students have other alternatives to have better visibility of their own performance. But in the rural areas, they have only single source of inspiration for academic inputs, that is the teacher. And we have made the specialization to such an extent that this is only a mathematics teacher will speak about mathematics, language teacher will never speak about mathematics. This kind of issues also we have made it. The other issue I just wanted to make is like perceptions of elders or the school educators. Without evidences, maybe short of evidences, we speak about the ability of the student to participate in this subject or the perform. Maybe in maths, we categorize this student is not able to have better mathematics, or he is not having better clarity about the language, or not performing well in the school, or is suffering from family background. So many things we keep on draping the cloth on the problems on the child. The other aspect we also make in the classroom, these are all normally happening, which I have seen as a teacher or as a educator, comparisons of various types we make in the school scenario. The next is overemphasizing the problem. For example, the whole school starts working or allotting very disproportionate time on certain subjects or certain activities. There also child gets confused. If it is mathematics, then the whole mathematics is taken so tough by the child. Once he takes it as tough thing, it never enters. The easier things also refuse to enter inside the heart of the child. Then another thing which the keynote speaker of the today, Dr. Sheshadri, also referred, the relation between the students and the teachers. So these are some of the issues which I thought would be relevant to be brought home during this. Problems could be anything. I may be permitted to take very minor issue bothering the students as such, with the example of which I have already told. The possible strategies for this could be, interventions could be, preparing our teachers to gain mastery in the concepts and the contexts. Both are very important. Many times, that is how I just gave the example of the girl child who dropped out of the school. If the teacher is not able to have the mastery in the concept or the context, he or she will not be able to reach the heart of the student. There ends the matter. We are creating unnecessary pressures on the mind of the child. The second issue which we have, I make it as a strategic issue, is enabling students to access smoother assessment scheme away from rote learning methodologies. Fortunately, in the National Education Policy 2020, these issues have been dealt very exhaustively. We have to make assessment more friendly, more useful for the child. The child should be able to have the visibility of achieving the learning outcome. I am not able to accept that a student fails. I don't know why we refer student as failing. Probably as a teacher, I would rather take it as it's my failure that I could not reach the student. But unfortunately, we are giving marks and making the children fail and pass, making a big demon out of proportion here. Then the third aspect is, it is once again very exhaustively covered in the National Education Policy, having the constructive approach in the classroom for transacting the learning points, and also making the learning outcomes very clear before the learning is initiated. Teachers using the terminologies prevalent in the relevant local area is also very important. The appropriate training for the teachers is also essential. Then allowing flexible deadlines or letting the students have an option to redo works so they feel more confident during turning it in the transaction. What it means is that allowing the pace of the learning for the children. It also means that I always keep telling this, that if at all some of the students are the fast learners, we should also have the good heart, providing them the opportunity to learn better concepts or higher concepts if the child desires to do so. Many people feel this will create discrimination inside the classroom. But let us remember that keeping a very powerful child limited to only limited activities will definitely is something like keeping a bomb inside the classroom. Anytime it can explode or it can disturb the whole classroom atmosphere. The next strategy I would like to suggest is the identity of the child need to be kept alive and projected in the school atmosphere. Many a times we make all the 40 children in different social contexts as equals or equals. If the child is failing to have his identity or her identity, then definitely they digress from the academic transaction. The next strategy could be helping the teacher to recognize escalating anxiety in a child and equipping them with the tools to intervene and help the child to implement strategies that help manage their anxiety. There could be a number of reasons for the anxiety, which the local school, as Sushmita ma'am has said, has to make a plan, a detailed plan for understanding the child or understanding the mood of the children. This is somehow, it is also allowed, but many a times it is not practiced. I give a small example, allowing breaks or opportunities to de-stress in the school atmosphere. Let's take an example of a rural school where the teachers are not staying in the local place. They travel from 30 or 40 kilometers away. So the school exactly starts at 10:30 in the morning, and it has to close by 4 o'clock because the teacher has to catch his or her bus back to home. Within that period, they have to complete 8 periods, the subjects, sticking to the timetable and doing all activities. But de-stressing never takes place. Day by day, the tensions keep on mounting upon. Therefore, we have to train our teaching, non-teaching, and school administrators to be more sensitive about these issues and also make them more positive thinkers. During one of the talks today, it was also referred that we need to have a periodic audit of the mental health and the academic support and the mental health of the school. The reason being, we should not be the party to pass on our anxiety to the students in advance. What I mean to say is that in a fit of improving the school atmosphere or making the students to get more and more marks or the grades, we rather tend to pass on our anxieties to the students and use the students to perform in the way we desire. Rather, in reality, every child wants to learn the way they desire. So this is what we need to provide as a strategy from the point of view of academic aspect. I would like to close by thanking the chair for permitting me to speak. Thank you.
Thank you, Mr. Ramachandra. We know that you will have so much to add to that because your paper has highlighted whatever you have experienced in the school. Thank you. We will now move to the second paper presenter, and I request the other paper presenters, if you can kindly stick to the time, maybe we can just give you 15 minutes. The second paper will be on early identification and intervention as protective and proactive factors for enhancing mental health and well-being among students. The paper presenter for this paper is by Dr. Prachi Gildial from NIRI, Shillong.
Thank you very much, ma'am. And a very good afternoon to everyone present in the session. I have been given this topic on early identification and intervention as protective and proactive factors for enhancing mental health and well-being among students. Ma'am, is my PPT visible?
Yes.
So I will just begin with a very brief overview of what mental health is and why we are talking about it, and then I'll move on to the role of the school and how we can identify issues at an early stage. So as I think we have already been talking about this since morning, mental health refers to a state of complete physical, mental and emotional well-being and not merely the absence of disease or infirmity. So this is when we are talking about mental health and well-being, we are going beyond just not being sick. We are talking about a person who's able to realize his or her potential, is able to cope with the usual stresses of life, and also able to contribute to the community by learning well and working well. This quote from Sushruta, a proponent of medical sciences in ancient India, is very relevant, I feel, over here. When he talks about mental health, he talks about the Prasanna, Atma, Indriya and Man, a very holistic and comprehensive understanding of well-being, where the soul, the sense organs and the mind all are in a state of contentment. So this is what we look for when we talk about mental health and well-being. It's a continuum which is experienced differently by individuals. So it's like people experience and react to the life situations in very, very different ways. Going on from here, I would like to now say why we are talking about schools as a setting for mental health. Approximately 1 in 5 children display signs of poor mental health and at any given time meet the criteria for a mental illness. About half of all mental illnesses begin in childhood and adolescence. A lot of children are struggling with mental health issues and they are undiagnosed. And it's like the numbers are like 20% of children in a country like America are undiagnosed. So we can really imagine what would be the situation in our own country, where we really are lacking in facilities for mental health promotion. So given this context, we are saying that schools are an important setting for identifying mental health issues and providing the much needed support at the right time. So it's not only for identifying mental health issues that schools are important. Schools are a very good setting also for implementing large-scale initiatives for promotion of socio-emotional as well as moral development. So we are not targeting only people who are already at risk or already showing symptoms of mental illness, but we are also targeting the entire school going spectrum, all children who are going to the school. It is important to talk about mental health in schools and also to be able to identify it at an early stage, because it is helpful in improving academic achievement rates and decreasing grade retention and dropping out. School programs that focus on social, emotional, and academic learning from the very beginning, they have been found to improve school attitudes, behavior, and academic performance. Students spend a very, very large amount of time at school and are therefore, they are very much accessible. We can have children in a big group for any mental health promotion interventions. Strengthening the student protective factors and resilience within schools reduces negative risks and outcomes for vulnerable children. It is also related to decreased violence and decreased juvenile crime. So when we are able to identify and intervene at the right time. Schools play a significant role in the early recognition and identification of children with mental illness, and also in altering the school experience of these students to yield better outcomes. Now, it's very crucial for us to understand why we should be focusing on interventions and early identification at the school level. When a parent looks at his or her child, parents are generally not able to understand that their child, whether their child has reached the developmental milestones, has been able to achieve those milestones, or whether his behavior is really not in keeping with that of his cohort. So they generally overlook very crucial and vital symptoms that can foretell a problem for the child in the future. But when we talk about the school, the teacher in the school is in a very unique position to be able to identify problem behavior in a child, because she is or he is looking at a big group of around 40 people in the class and has in most cases an experience of seeing children over a period of years. So the teacher in the school is in a much better position to be able to identify that yes, this particular child is not behaving the same way as most others do at this particular age. So I'm not saying that any kind of different behavior is going to is a symptom of a problem, but it could be a telltale sign. School is also a very familiar and less stigmatizing or threatening environment for students in need of help compared to hospitals and medical offices. So we need to really focus on early identification and intervention in the school setting. Improving student well-being can help in reducing the stress of teachers, because it's a very difficult thing for teachers to it's very challenging for them to be able to manage children who are showing some problem behavior. So when we intervene at the school level, we can really help these children, and in turn also contribute to work satisfaction and retention of teachers. Schools are also uniquely positioned for helping us to let children adopt healthy behaviors, which are going to help them in their lifespan all across their life. And relationships established at school are protective and very supportive, and also again a lifetime kind of resource for them. Children learn to express themselves and actively participate in social activities at school and community projects, and these experiences enhance their social connectedness. Again, another reason for early intervention and identification is that there are some crucial school experiences which have been found to be associated with poor mental health outcomes. Bullying is one. Bullying has been found to be leading to suicidal ideation, suicidal attempts, higher proneness to anxiety, depression, and self-harm. Again, poor teacher-student or poor peer relationships can also lead to psychiatric disorders and poor academic attainment. And these could also be the poor teacher-student relationships or poor peer relationships could also be signs of children at risk. So how do we do this? Early identification and intervention for mental and behavioral problems can serve as protective and proactive factors for student well-being. Early identification actually means being able to recognize the signs and symptoms of problem behavior or maladaptive behavior at the very outset and at a very early age. And if we are able to identify at an early age, we can arrest the development of problems and arrest their spreading into all aspects of the child's functioning. So early identification is crucial for timely intervention. Once we identify, we can arrange for the right kind of intervention for the child. A number of mental health conditions will have a favorable outcome if identified earlier on at onset itself. So especially things like depression, substance use, and behavior problems. And this is very crucial to the well-being of children and their proper development. Again, the interventions that we generally talk about, which I will be mentioning in just a couple of minutes, they are really focused because we are talking about interventions at the school level. So they are not very, very specific to a particular illness. They are actually aimed at promoting well-being, and so they benefit all children at large. So these are some of the things that we can talk about when we think of early identification. The first thing that we need to remember when we talk about early identification is that it is not required for teachers to diagnose a problem. That is going to be risky because teachers are not actually equipped to diagnose problems. What they could do, which is going to help children, is identify the areas in which the child is facing certain difficulties. So they need to identify the child's difficulties. The teachers or the school needs to support the mental health of all children, including the ones who are at risk. So it is not this, when we talk about early identification and early intervention, it's not specific to a child with a problem. It is meant for all children. The teachers need to know when the problem is severe enough to warrant a referral. They need to identify and address problems at an early stage by intervening early. As I already said, it is more likely that a serious mental illness can be averted. It is also important to balance the risk of labeling a child at an early age and the importance of early identification. So often we hear of people or teachers saying, oh, that particular, in fact, I recently visited a school where I was doing primary class. It was 5-year-olds who were there, and the children in the class, they said that one particular child was very slow. So a 5-year-old said that he has cheated. So calling a 5-year-old as slow, or calling him a cheater, or calling him a liar this is a fallout of kind of early identification. So we need to be very, very cautious of how we can balance the risk of labeling. So once you label a child, you can be sure that he is going to fulfill your label. He is going to work according to the label that you have put on him. So we need to be very cautious of that. Another thing which is important when we are talking about early identification is, and also intervention, is that we have to be cautious of oversensitizing students to issues. So recently I experienced, this was an experience where a child was complaining of being bullied and she didn't want to go to school. So I asked her, what bullying did you experience? Now, the child told me, no, my classmate called me stupid. Now, I felt that just because the child has access to this vocabulary of being bullied, she just assumed that she was being bullied. In most cases, children, this could have been overlooked. But the children nowadays are also extra sensitive to what is happening to them because of the vocabulary that they have at their disposal. They have heard the concept, so they apply it. And the same holds for teachers. There has been a very high rise in the incidence of the diagnosis of ADHD, which, like, a number of teachers I have met, they just say that, oh, this child is hyperactive. A 5-year-old can really be very, very active without actually needing the diagnosis of being ADHD. So we need to be very cautious of these issues. Again, we need to create a conducive environment for all children in the classroom, so that they can feel free to express themselves. They feel safe. They are warm. They experience warmth, acceptance, and trust.
Dr. Prachi?
Yeah. Yes, ma'am.
I'm able to give you just a few more minutes.
Okay, I'll just wind up now, ma'am. 2-3 more slides. So some indicators of mental health problems. This is a manual that has been developed by WHO, and it talks about some of these indicators: a sudden drop in scores or academic performance, sudden withdrawal or isolation from peers, being too emotional or quick to anger, frequently getting into fights or defiance, sadness and crying, bizarre behaviors like responding to things that are not there, becoming mute or disengaged, truancy from appearing too tired or sleepy in class on a consistent basis, repetitive behaviors, self-injurious behaviors, significant changes in weight, and frequently leaving the class due to pains and aches that do not appear on weekends or holidays. When to refer to a specialist? When behaviors or symptoms are getting worse rather than better, when behaviors are negatively impacting the child's functioning at home or at school, when symptoms are severe or distressing, and when there is a risk or danger towards self or others, when interventions in the classroom are not enough. Some general interventions that we could think of for all children: empathic listening, stance, accepting the student and conveying this acceptance, validating the student's feelings and experiences, modeling positive mental health strategies such as relaxation, mindfulness, and managing stress, helping students challenge negative thoughts and problem solve, providing academic support, timely referral, and enlisting the support of family and peers. And this is the last slide that I have, where I would like to just talk about how the school administrators can work for early identification and intervention. The schools need to develop policies and standard procedures for identification of children, providing support and a protocol for referrals. They need to also let teachers know who they should contact when they find a child who's having some problems. A school could have a child study team which could discuss and plan for struggling students. Ensure that teachers are informed on some common signs of emotional and behavioral difficulties. This could be done through regular workshops and awareness programs. Provide support to teachers when they report a child with mental health issues. So the teacher cannot handle such things on their own. They need the support of the whole school. And that's why we talk about the whole school approach also. The teacher's mental health and well-being is as crucial as that of the child's, for the child to be able to, for the conducive classroom environment. So collaborate with the child's family, talk about mental health issues regularly so as to wear off the stigma that is, so we need to start talking about it. Have school counselors who are easily accessible, and ensure that children who seek help are not labeled, and have systems in place for discreet help seeking and maintain student confidentiality. When in doubt or the student is not improving, refer for an evaluation and ensure a positive school climate and the well-being of teachers and staff. With this, I think we can make mental health and well-being for all a global priority. Thank you very much.
Thank you. Thank you, Dr. Prachi. We will now move to the third paper presenter. This by Mr. Samarth Pathak, who is from the United Nations Office on Drugs and Crimes. And the paper will be on mental health in schools, empowering students to be change catalysts. Mr. Pathak, please.
Thank you, Dr. Khar, and namaskar to all the esteemed attendees. On behalf of the United Nations Office on Drugs and Crime, UNODC, I'm truly honored to join this very important national conference on mental health and the role of schools. My name is Samarth Pathak, and I head communications, advocacy, and youth and education focused initiatives at the UNODC Regional Office for South Asia. Our deep gratitude to the MANODARPAN cell of the NCERT and RIE Bhopal for convening us today. Today is the International Mental Health Day, and this is an important occasion to reflect on the importance of education and education systems when it comes to addressing mental health challenges among young people. Let me just share a few facts before you. WHO estimates suggest that globally, 1 in 7 10 to 19-year-olds experience a mental health disorder. Depression, anxiety, and behavioral disorders are among the leading cause of illnesses and physical disability among adolescents. And suicide is the 4th leading cause of death among 15 to 29-year-olds. There is a very famous quote that I'm sure all of us have read or heard at some point of our lives. Be kind always, because everyone you meet is fighting a battle you know nothing about. And this couldn't be more true or more apt than it is for young people today. Indeed, many young people today are fighting a very serious mental health battle. Look at the prevailing global scenario and the last 2 years of the COVID-19 pandemic. For perhaps the first time in their lives, young people have witnessed death, disruption, lockdown, and social upheaval to such a huge extent. There are other risk factors too, arising from gender and digital divides, increasing exposure to cyber and virtual space, climate change, and conflicts. These have also aggravated their vulnerabilities to exploitation and abuse, anxieties, depression, bullying, harassment, substance use, and other risky behaviors, including crimes. And in this context, there is a need to rethink the way we engage with these young minds through education. Educational leaders like yourselves, teachers, have a critical role to play in not only supporting students or raising awareness around mental health, but also in enabling and empowering them to become peer catalysts of change. And the time to do this is now. As per a study, approximately 75% of psychiatric disorders are developing prior to the age of 24. So how do we do this? It all starts from the classroom, which is the second home for a student as well as an educator. First and foremost, it is important to understand and let it be understood that in the classroom, that mental health is a disease and it can be addressed. As people, you would agree, there are 4 essential qualities that leave a lasting impression on our minds, something that inspires us to emulate. These are kindness, fairness, empathy, and integrity. And in the classroom, we must be kind, empathetic, and fair in engaging with students and show the highest levels of integrity in our work, while also encouraging students to follow and emulate the same. At the same time, it is equally critical for the educator to be in a positive frame of mind. Mental health challenges, be it of educators or students, need attention. And therefore, the approach has to be two-pronged, one aimed at educators and the other aimed at students. The key here is to provide a safe space for an open conversation, active listening and engagement, like some of the previous speakers have mentioned, identifying signs, removing the stigma around mental health, and helping others receive support, counseling, and other services as required. And this can be done by classroom interventions, classroom dialogues, as well as creating students-led networks and peer groups, especially around bullying, discrimination, depression, etc. Small things also matter, like smiling, making eye contact, showing you care, allowing the students to speak, asking questions, and looking for signs in body language, etc., can go a long way. Our experience at UNODC also shows that an emphasis on enhancing integrity and ethical behaviors among young people, sensitizing them on social themes through the Sustainable Development Goals, and empowering them to use their own skills in becoming problem solvers can be a game changer when it comes to addressing mental health issues. This can be done with activity-based learning, interactive two-way dialogues, reflection sessions, and educational materials, including games, videos, cartoons, which UNODC has carried out successfully over the last several years. Through education on integrity and ethics, peace, crime prevention, and SDGs, students can be effectively guided towards a state of well-being in which they realize their own abilities, they can cope with normal stresses of life, can work productively and fruitfully, and can make a positive contribution in their communities. This is also reflected in India's National Education Policy 2020. Prime Minister Narendra Modi also has repeatedly called for meaningful participation of young people in nation building. And therefore, we must strive to use education and activity-based learning and not merely awareness to sensitize children and young people. However, this has to be a systematic and interactive process because social awareness, ethics, integrity, a sense of purpose, and working towards emotional well-being is something that is not learnt, but imbibed and inculcated. These cannot be promoted with lectures, talks, or one-off events. These can be imbibed only with actions and experiences. And these are areas that require special attention, mentorship, nurturing, and continuous creative classroom engagements imparted in a language and setting that the students can relate to. Only then can the students champion these themes and become catalysts of change. And this lies at the heart of what we do at UNODC. Over the last several years, we have done this quite effectively through a range of global and national initiatives in cooperation with already existing educational systems. Our aim is not to reinvent the wheel, but to accelerate it. Our global efforts in education are or have been covered by three key initiatives. The Education for Justice program, which focuses on promoting a culture of well-being and lawfulness among young people through education. Lockdown Learners series, which we developed in response to COVID-19, and the GRACE initiative on integrity, ethics, and other issues. Our youth programs involve students, educators, as well as families on enhancing socio-emotional resilience, peace, and integrity. These are issues or themes that sometimes go under the radar, but are crucial. These initiatives include highly interactive classroom sessions, continuous classroom sessions, educational aids, content, activity-based learning, and storytelling. At UNODC, we have developed and disseminated these educational resources, which are available free of cost for educators, for resources, and I'll be more than happy to share them with you. These include classroom handbooks for teachers that detail various activities that can be conducted, especially in conducting participatory trainings or classroom sessions by the teachers or even students themselves. And the emphasis is on providing a safe space, a very informal setup where students can also engage in self-learning, classroom learning, as well as peer-to-peer learning, and have open conversation on different aspects of life, including crime prevention, mental health, integrity, discrimination, and depression, among other things. Uh, Most of our work falls under the SDG framework, the 17 Sustainable Development Goals, through which we can effectively engage young people in 5 things. One, understanding social and emotional challenges. Two, developing a sense of purpose and integrity and respect for others. Three, acting and creating solutions on the SDGs. Four, participating in decision-making processes. And fifth, using their own skills and ideas on different projects. Our latest example of success in this direction has been the Lockdown Learners series in India, through which we provided a positive framework of action and mentorship to over 19,000 students and educators across 16 states and union territories of India during the pandemic. We worked with Jawahar Navodaya Vidyalayas, public, private, and rural schools, as well as different educator and student groups from various socioeconomic profiles. And Dr. A.N. Ramachandra has, of course, been a huge pillar of support in this. Our effort has been to bridge socioeconomic and gender divides, because when it comes to mental health issues, we must leave no one behind. Uh, our sessions have engaged students at the secondary level on SDGs, on peace, and on different aspects, including mental health, cybercrime and harassment, misinformation, gender equality, and integrity. At the same time, we have also conducted participatory capacity building initiatives for educators and mentored students in developing their own initiatives. The unique part of these interventions were that they were not one-off sessions, but a continuous series with each student group, with the presence of an educator and in partnership with the school. This was to ensure continuity in our interactions and to build a relationship with each student group that we are working with. The idea is to get students inspired on one issue, maybe even mental health, that resonates with them, get them to talk, reflect, and do something. Through these interactive sessions, students share their deepest thoughts and know that they will always have a listening ear. One thing that has been very clear to us during these initiatives is that initiatives that are mentored by educators but are executed and led by students work the best. Peer-to-peer influence is extremely high, and with support of educators, students simply take on the responsibility to empower other students as well. And in this process, they become more confident, they take leadership roles, they do research, they take care of each other, coordinate activities, and their personality develops and they become peer influencers. These are useful life skills as well. This works. As an example, in the Mirza Murad village of Uttar Pradesh, we have worked with a student group where we had a young girl from a rural background who was extremely shy, underconfident, and with severe anxiety issues when we first conducted our sessions. Over time, she shared how she felt very strong gender discrimination around her from all fronts, which had made her deeply anxious, scared, and uncomfortable in expressing her views. And but she wanted to do something about it. So through the SDGs, we involved her in a couple of projects around SDG 5 with her peers and other community members. And she very silently but very diligently started working on it. And gradually she has just blossomed and become such an amazingly confident student. She has participated in a range of UNODC forums, UN forums, and even a media interaction, sharing her thoughts and opinions freely. So she's no longer feeling anxious or scared, and she has completely overcome that challenge for herself. And that's the power of education. Why these interventions work, or why such interventions can work, is by simplifying and contextualizing the language around these themes, reaching students in a format that they are comfortable in, giving them a local or sometimes even hyper local context, build safe and open spaces for students to express their thoughts and ideas, create information repositories, and build youth and educator networks of action. Uh, these, I think, can lead to a lot of behavior changes. And in fact, for some of our interventions, educators and students and parents have actually reported behavior changes within themselves. We have a growing number of students who are becoming integrity and SDGs teachers themselves. They are conducting the sessions that we do with them, with their own peers. They are engaging with their peers and communities, designing social initiatives around bullying, discrimination, gender equality, among other things. They are using their skills in art, videos, music, theater, in actually conducting, awareness, raising awareness on these themes. So one thing has been clear to us that integrating education on integrity, mental health, and SDGs in the classrooms can truly empower students and educators, and one can really see the impact that they are creating. And at UNODC, we seek to join hands with all of you in this direction. We are very happy to share educational resources, teacher guides, conduct such interactive sessions, and build educator capacities and youth capacities on these cost-effective initiatives. Uh, Broadly, we offer our expertise and knowledge support in driving 5 key areas. 1, student engagement and interventions. 2, capacity building of educators. 3, providing educational resources and tools. 4, developing school-centered and school-led initiatives. And 5, in enhancing family skills. We have a separate program which involves families in addressing risky behaviors among young people. And as the previous speakers have mentioned, the role of families cannot be understated. In conclusion, I just want to add that today, young people are increasingly looking for a reset where they can be heard, included, and mentored, where they can emerge and act as lighthouses, guiding themselves and other people on mental health, on SDGs, on integrity, on peace, on social change. All they want to do is to have a listening ear. They just want to have a listening ear which can listen to them patiently, and then they can blossom. And as educators, we must be there to enable them to become these shining lighthouses, empowering them with confidence and skills, helping them overcome their mental health issues, and guiding our societies towards a better, just, and more peaceful future. UNODC stands with NCERT, the Government of India, educational institutions, educators, and young people in this quest, and we are very open to collaborate. Thank you very much for this opportunity again. Please feel free to connect anytime on samarth.pathak@un.org or visit our website www.unodc.org/South Asia. Thank you very much, ma'am.
Thank you. Thank you, Mr. Pathak. We will now move to the last paper presenter. We have Professor I.P. Gaurava, Professor at Head of Department of Education from RIE Bhubaneswar, and she will be presenting on integrating mental well-being with school curriculum and pedagogy. Ma'am, please, I hand over the session to you. Professor Gaurava?
Yeah, good evening.
Yeah.
Good evening, and thank you, organizers, my dear colleagues of NCERT, and all the administrators who have joined here. We have listened to the earlier speakers on the theme, and mine is specifically on how to integrate curriculum and pedagogy in bringing positive mental health among the students. That is especially in a classroom and little in the school, how we can create this kind of a space so that it is ensured. The emotional well-being of youngsters are ensured. See, we all know that the function of school now is not leisure as it was conceived previously or when it began, or it is not academic achievement per se. Rather, the function of school is to give safety and security to all the children who are there in the young age, giving that psychological, physical, safe and secure environment, and also giving a cognitively challenging learning environment, because the learning, the youngsters, when they are growing, they demand, they look for enhancing their cognitive potential that is innate in every child. So the task which is given in the school has to be challenging. It is not that we have to specifically promote critical thinking, creative thinking, analytical thinking. Rather, our learning space or the activities, the pedagogical approaches we use automatically make a child think. We don't have to make additional effort how to give a specific task to analytical thinking. Rather, it is the learning engagement itself is cognitively stimulating. And the third one is the economic, making an individual economically independent or self-reliant. So the curriculum and pedagogy are the tools or the vehicles through which we reach these requirements of the school. And I would like to share my screen quickly and let us quickly, it is mental well-being in school through curriculum and pedagogy. Specifically, let us delve into the data and identify what does the data say? Why children are troubled? So the earlier speakers also mentioned the difficulties of children. What are the specific reasons? So we have a very recent data with the survey, the mental health and well-being of school students conducted by MANODARPAN cell, which gives something, the reason for stress and anxiety as hesitation in asking questions. Children feel stressed. If they want to initiate a conversation, they are anxious. They are anxious due to academic aspects like studies, not keeping up with the colleague, not peers, not being able to catch up with the required academic tasks, and especially exams. So these gives stress and anxiety. And of course, teachers' inattention is found to be another factor, and lack of peer support. Now, as teachers, as a huge number of administrators are here and counselors also on this platform, a simple question to all of us as leaders in education: how can we bring these simple? If a child has hesitation in asking questions, how do we create that opportunity for a child? Because once these simple factors which are identified, it doesn't look to be a huge task. Of course, if there are certain other issues, it may require professional help. But looking at these things, initiating conversation, how can the pedagogy support these and see that our children are comfortable in the learning space? So at this juncture, it is that we have to look at what the emotional support to students by giving the curriculum is already designed, provide the required to support the functions of the school, and how well we use the curriculum to specifically identify the approach and reach the students so that it supports the well-being of students. So how do we as teachers or school administrators, like it should be part of the whole program, the school program. Teachers given autonomy to engage the learner in multiple modes, because here we cannot say one size fit all. We don't know. As the earlier speaker was telling, everyone is fighting their own battle. They may be wanting to engage in the learning situation, but the way we are offering the space is not suitable to their style of learning. So the best way to do it is we can identify multiple modes of learning engagement so that it suits every type of learner in the same task, on the same task. One may want to listen and learn, or one may want to do and learn, one may want to discuss and learn, one may want to use the technology and learn. For the same content, a teacher can design multiple ways of engaging the learner. So according to the suitability, according to the interest of the learner, they can choose the way they want, and it engages them cognitively and they happily go ahead. So this creates the opportunity for every learner in the classroom. Then we can analyze the pedagogical approaches for the content, and then it should suit the lesson. See, we cannot deviate from the lesson or the content. Rather, the approaches which are selected are in tune or in sync with the content and the requirement of the content of the lesson which is chosen. There are certain other things like how, see, we can include basic art, craft, games. These are mainly from the NEP 2020 perspective. Every lesson can try to integrate certain basic art. It may be drama, it may be drawings, it may be doing certain crafts, engaging in some sports activity. We can plan depending on the lesson. Prepare them for every class. We can focus on developing certain skill for the future. For example, the factors which we saw are specifically say about the one of the skill there I can identify is a communication, initiating a conversation. If I want to ask something, because asking something relieves so much of stress. It may not be about understanding the content, rather it is anything. I feel like asking something, if I'm not able to see the blackboard, I'm not even as a student have that confidence of us asking the peer or the teacher that what is written on the board. So these only can indicate the real trouble of the child, but the child is not able to ask a question in the class. We can understand the amount of frustration they undergo. If the simple opportunity, the freedom to talk to each other in the class. And of course, the pedagogy which we choose, it can be with the stages of development. For a young child, what would be appropriate? But we cannot say that art and sports cannot be used for later stage of education. It depends on the content and also depends on the individual who are interested in expressing themselves through different medium. In every classroom, through every lesson, we can also provide opportunity for expressing or taking up responsibility. We know especially the young adolescents have great passion for owning something, taking responsibility, performing the task so that they feel that their capacity is known by themselves and also appreciated by others. A classroom task can give them a responsibility and then give them the opportunity to express it and feel contented or feel that they are capable of doing it through the appreciation of peer and the teacher. These are some little more into the curriculum. The pedagogy and curriculum, we can integrate in such a way that it happiness in learning. Nowadays, learning has been viewed as it's pressure. Learning has become something which is a pressure for students. We have to convert into a pleasure, the way they want to engage, not comparing learning with each other. So by doing and allowing them to explore and engage in the way they want, if they are friendly or if they are good with, or they like to learn through technology, that option can be given. If they like to discuss with others, we can give that opportunity. Talking to elders, if not in the school itself, we can give simple tasks of discussing in the neighborhood, in the family, about certain, depending on the content. For example, if it is on agriculture produces, the lesson is there, the question is there, answer is there. Instead of sticking on only to that, why not talk to the family, the neighborhood, and find out what are the agriculture produce of the local area? How is it grown? Link it with the reproduction of plants. They can observe, they can document, and talking to elders, by doing it, their own abilities come out, the skills will develop. The skill of documentation, skill of observing what they document, and skill of analyzing and interpreting, predicting what might happen. For example, rainfall or weather, the temperature of the location. Instead of going by the text only, they can look at the local, they can connect it to the local, so the learning becomes very meaningful. As much as possible, the culture, that's what, for example, if it is food and nutrition, we can always look into the culture of the family. So they let children discuss with each other in pairs or in small groups. They can find out the food habits of different cultures, and they can analyze the nutrition values, and they can appreciate their culture and how food is food is a way of bonding between each other. Why certain festivals in certain seasons, this particular food is prepared, and what is the relevance of that with the season, and what is the relevance of it for the physical and mental health. Even food is not just for the body, it is also for the mind. So they see, if this kind of an activity is given to teach the lesson food and nutrition, critical thinking, creativity, how well they can make food, and a value for others' culture, recognizing others' culture and appreciating the way others do it. Even festivals, it is not just, see, for example, if it is Durga Puja, there are different variations of Durga Puja celebrated in variety by people, and region-wise there are differences. Names are different, but the central theme may be same. And there may be some children in the class who are unaware of Durga Puja. Instead of making them feel isolated in the discussion, how children who do not know at all about a festival can be brought in by giving them chance to speak about their festival, which is similar to that. So this kind of bringing the culture, bringing their local realities into the classroom will make them feel one with the learning space. And this is from NEP 2020. What is holistic pedagogy? One, it should be flexible. The way I want to learn, the approach I want to choose to learn the topic. We can integrate it. Science, social science, fine art, music, integrate as much as possible and learn through discussion. This would really take care of the hesitations of the children and the feeling that nobody is attending to me, that lack of inattention being one of the reasons for stress among students, because we know young children like to be recognized. They want their knowledge, or they want their selves to be identified. So either with the adults or with the peer group, both are equally important if we can provide discussion-based learning and what they like, the center, what is meaningful to them. to their culture, their family, their locality, their region, and discovery oriented as much as possible, giving some space for them to discover and come out. Inquiry driven, questioning into the content. How can it be done? Everything can be converted into story, or we can make children create story. If it is photosynthesis, why not a plant narrating it as a story? We can make the children create the story, or if teachers, we want to do it, if we have time and patience and passion for doing this as teachers, we can begin the story. We can let children continue it. Take the content from the book, use the terms. The chloroplast, the photosynthesis, the carbon dioxide, all the terms can be used and it can be converted. Children can create. Or if it is village life, the lesson on village life, something is given in the textbook, but there may be many other stories associated with the village life. If the child knows about the village life, they can create their own stories, or the child is unaware of village. For example, a child born and brought up in a city may not be aware of the life. They can talk to neighbors, elders, and find out what is it like, or even go to take the help of technology and understand what is village life, so that they feel like discovering it for themselves. How is the life of a villager? How do their routine go on? It's so different than what we live in cities. So they understand all this, and their critical thinking will naturally, automatically develop. Any lesson can be converted into a story. Teachers need not take the pain of doing it by themselves, rather give that opportunity. Children can do it. Of course, communication. We can encourage interaction between, like for example, a very simple and a doable task by every teacher is think, pair, share. Think, talk to each other, and then share it with the larger group. One small task can be given. Two can talk to each other. We have to make the classroom a talking space. Interpersonal communication for learning has to be encouraged, which can very easily be done, even if it is a problem solving. Mathematics. Children find it very difficult if they think that it is highly cognitive task. It is, no doubt. But through communication, that becomes simpler. It becomes very known. They can talk to each other. What is this? They can visualize the situation of such problem so that their solving becomes easy. So instead of me doing alone, if I have a support of doing the same thing, I feel so much empowered. I feel that the trouble is not just mine. I have somebody to share. All these can be an approach for pedagogy, which helps the child to feel relieved, stress-free in the learning environment. Of course, communication. See, these children, they can do multiple things. Globe is a wonderful learning tool. They can talk to each other. They can identify new countries, geography. How is this? The continents are located. What are the countries? So many things they can discuss. They can talk, and they can discover several things. Even
Yeah, I'm sorry to interrupt. Can we just give you another 2 minutes?
Yes. Of course, we know friendship, love, acceptance inside the learning space. The pedagogy strong with these. As much as possible, observe and explore the surrounding. Give them space to express. It could be in any way. It could be gestural, drawing, written, oral, talking to elders. How can we make the lesson enjoyable? Certain guidelines. Ultimately, children look from school environment, value for self, and how through the learning we can give value for self, love and care, appreciation and encouragement, and recognition. So by creating this kind of, by integrating curriculum and pedagogy for mental well-being, I'm sure it is not just for the children, even teachers, the administrators, can enjoy better mental health, because we also become learners with the children. We come out with lots of new things talking to children. Thank you.
Thank you. Thank you, Professor Gaurav. Now, a very big thank you to all the 4 paper presenters for such clear, simple, and very interesting presentations. It is
उनको ये ले लियो रूह अफ़ज़ा सभी अभी बोलना नहीं हो ना
anyone who would
पूरा
like
मैं चेक करना
I request the others, please, to mute.
मेरे चीज़ां क्या भी नहीं है सच नहीं मैं बेचता
Any questions, please? Is there anything which you would like to learn more from the experts?
वो साड़ी बराबर अंदर डाल दियो या वीडियो में डाल दियो
Okay, if there are no questions, can I give the last word? Anything which you would like to say?
नक्को अम्मू बैग कहीं को ले लग जाऊं आपके चाची वहाँ आने का मन बैग उठा ले को मैं ट्रेन में नक्का बहुत हो गए मैं क्या बोली तो भी बहुत खुद तो बात करो मुझे क्या कर डाली अम्मू
I request the other participants please to mute. Okay, it seems that there are no questions, but can I have the last word from the paper presenters, from the 4 of you? Is there anything which you would like to say? Can I start with Mr. Ramachandra?
Ma'am, I don't have anything to add except to reiterate what I said, that all of us together as educators will have to think that we are also like students who also carry as much of the anxieties which the students have, and then participate with them in resolving the problems of the issues of the children. Probably we will be of great success. And the second point I just wanted to reiterate once again, that through academic issues, probably we can address a lot of issues with the students. Thank you.
Thank you. Thank you, Mr. Ramachandra, for such a good presentation, which highlighted your experiences, and that made it so lively and so interesting. And like what you said, and what also Mr. Pathak said, it is the time for us as counselors, as teachers, as administrators, to reflect first on ourselves. What is the kind of mental health that we have? And I liked the 4 attributes which Mr. Pathak mentioned. Are we kind? Are we fair? Can we empathize? And do we show integrity in our behavior? I believe that once we are able to show this from our side, then the same also will be passed on to our children. Thank you. Madam Prachi, do you have anything to say, please? Can we move now to Mr. Pathak?
Ma'am, I don't have much to say now. And I'm so sorry my camera is not working. So I have...
Doesn't matter. But like what Madam Prachi spoke on early identification and intervention, it is a very important area which we need to work on, because usually this is done at a later stage when things have grown to be very, very serious in the life of the child. So I believe this is what we need to start, and we should start it from a very, very early age. I know, yes, that some of the schools have done this, but when we look across the country, this is an area where we really need to work on early identification and prevention. Mr. Pathak, can we hear anything from you, please?
Thank you, Dr. Khar. Actually, there's nothing left to say after such a insightful, I would say, masterclass on the mental health challenges that we face in school and such eminent speakers. But I would just like to conclude by saying that, I mean, I always give this example to young people that, you know, it, it comes from within. You know, it's like a lighthouse or a spark that is lit from within. And this we experienced, and of course, Dr. Ramachandra and the JNV people and the other educators that we have worked with, you know, I've told them and we have discussed this, that this is more of a, you know, personal initiative that, or a personal investment that you have to make, a personal commitment towards the students, because a child is looking up to you. And they are, of course, going through such, we don't know what's going on at home. We don't know what is going on with their peers, unfortunately. And there is a tremendous risk. We see so many young people falling into substance use, crime, and delinquency at such young ages because peer-to-peer influence is very high. And all we did, you know, in our interventions through the Lockdown Learner series was to capture on this peer-to-peer influence. If it can be used for nefarious purposes, why can't it be used for more productive purposes, where we can also counter perhaps bullying or harassment? And I would also tell you one thing, that children are so pure at heart that emotions, they can be captivated with emotions. You know, so every child has a story that if you speak to a group of children, I venture to say 90% of them would tell you about an experience of bullying or harassment that they have faced within or outside school, you know. And how do we kind of respond to that? One thing that I did not agree with so much, you know, although the presentations were great, was that, you know, that one word somebody has used, a student has used, but you know, it doesn't really matter. Because, you know, even small things can matter to a child, and we have to be conscious that, you know, that thing may not be such a big thing for us, but it matters a lot to that child. So, and that triggers bullying because nobody else is hearing him out or hearing her out. So, I would say that one, the role of educator is, of course, to lend a very patient ear, to understand, to recognize the signs through body language, etc., and also to nurture those networks. You know, get 5-6 students to work together on a project. They also strengthen their bonds, and you know, you can get very valuable information from them as well. So and of course, lastly, UNODC is very keen to work in this direction with educators and with educational systems such as you. And we are very open to collaborate, and we do look forward to hearing from some of you.
Thank you.
Ma'am, if I may just respond to that, because this, I know it was, I said that bullying, it was, of course, I understand that a thing which may seem very innocuous to another person may be really very crucial for the child, of course. So that is why I talked about validating. But the fallout of is also, I mean, that is also very harmful for their mental health, because I'll just give you a very small example. The school where my daughter studied did a sensitization program after this molestation case that happened in Kashmir 3-4 years back. She was in class 1, and they were talking about good touch and bad touch, and then they just did it randomly without having any kind of without having any thought of what they are speaking and to whom. So what happened, when she came home, she was so scared. She told me that, Mama, a Didi died because of bad touch. She was just 5 years old, and she was so scared that she was not able to go into the washroom all by herself. So it is this thing that has really been there with me for all these years, and I genuinely feel that sometimes our purpose may be something, but what we end up doing may be something. So rather than
the flowers that she saw, also
we actually created a highly stressful situation for a child, and I'm sure a lot of other children of that age were also similarly affected. So it was in that context that I wanted to say that just giving giving people the words may also lead to labeling and all kinds of unintended consequences.
Thank you. Okay. All right. I hope that is okay with that. All right. Okay. And Professor Gaurama, I was thinking how you would integrate mental well-being with school curriculum and pedagogy, but beautifully you did that. And in a nutshell, it's like experiencing not only academic growth, cognitive growth, but also the affective side of the personality, experiencing that in a conducive environment. So with this, we will wind up this session. And I just want to say this, that learning that impacts on the child is not from the head, but it is from the heart. And when our heart is right with the children, then the learning also will go in a positive way and it will bring about holistic development. And I believe, again, if we are right with our mental health, the same also will be reflected in our children. So therefore, we play a very important role. Now with this, again, I want to thank the paper presenters. Thank you so much. It was such an enriching session, though it is the last session for today. And I know that the participants, they have really benefited from this. And may we all go with this, that each one of us, we play a very important role in determining and shaping the mental life of our children. Thank you.